special exception request for relief from grounding requirements for the Midtown Reliability Project and the TEP franchise agreement, and is being held pursuant to ARS Section 38-431.03, A3, and A4.
We have a motion to go into executive session, please. There's a motion.
Second.
There's a second. Any further discussion on going into executive? Hearing none, all those in favor, please signify by saying aye. Aye. Any against? Motion carries. Thank you all. We'll see you in 45 minutes.
gonna start 4 minutes or 3 minutes? Let me know, okay?
Councilmember Fimbres, we're settling in. We'll get started in just a minute.
Thank you, sir.
May I have a motion? Session, please?
So moved. Second.
There's a motion and a second. All those in favor signify by saying aye. Aye.
Aye.
Any against? Motion carries. Item 2 is direction to staff. What is the council's pleasure for item 2? Mr. Rankin.
Honorable Mayor, I'd ask for a motion that the mayor and council direct the city manager and city attorney to proceed as discussed in executive session and to take the following actions. 1, bring forward to the mayor and council a power purchase agreement with TEP under which TEP will commit to providing 100% of the electric power supplied by TEP to the city from renewable sources. And just to be clear, this means electricity used by the city as a customer, not all electricity provided to all city residents. 2, bring forward to mayor and council an agreement with TEP under which TEP will commit to provide essential infrastructure and equipment for an energy resiliency project at Donna Liggins Center. 3, engage with TEP to discuss an agreement to advance the goals and policies of the city's Resilient Together Climate Action and Adaptation Plan. And 4, move forward with public engagement relating to TEP's request for a new franchise agreement with a tentative election in November 2025.
May I have a motion for that, please? There's a motion. Second. There's a motion and a second. Any further discussion on this item? Councilmember Ulick?
Thank you, Mayor. Mike, in the first paragraph, and I apologize, this just occurred to me, it stipulates 100% of the energy for the city of Tucson as a customer. Would it be possible for the language to say at a minimum that be the result of that agreement in case there are opportunities for even more of the energy that we purchase or that's purchased in Tucson to be under that agreement?
Yes.
Okay. So I would request an amendment to the motion to insert at a minimum in the first bullet.
Okay.
So, Mr.
I
Rankin,
agree.
so the motion maker is accepting the amendment. And the seconder, of course, is adding the language. Can you read, just for clarity purposes?
So thank you, Mayor. With respect to that bullet point, it would be to bring forward to the mayor and council a power purchase agreement with TEP, under which TEP, at a minimum, will commit to providing 100% of the electric power supplied by TEP to the city from renewable sources.
Okay, sounds good. Alrighty. Alrighty, so there is a motion and a second. Any further discussion on this? Hearing none. All those in favor of the motion signify by saying aye.
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 Any against? Motion carries. Alrighty, thank you so much, Mr. Rankin. Okay, so now we move on to item 3. Time has been set aside to discuss for a discussion regarding the fiscal year 2026 budget and employee health benefits. Mr. Manager.
Thank you, Honorable Mayor and members of the council. We're getting a little bit further into the process for this fiscal year's budget development. What we'll be covering with you today are a couple things. One is the first glimpse at the 5-year financial forecast. This is not what the numbers will look like a month from now, but it really is a snapshot in time of the work we've been doing so far as a budget team working on what would FY26 look like. It provides the context for recommending a budget for FY26. And as we've been tracking with you, we are making progress toward getting toward a recommended budget for FY26 that would be a balanced budget. We're not there yet. But in your forecast that was shared in your materials and we'll go over today, we've brought the operating deficit for FY26 down to $13 million deficit. Again, our goal is to get to 0 or positive on that. And it does include some allocations for health care costs, as you'll talk about today, and that is the one action we're seeking from you today is guidance on the health benefits portion of the equation. It does still include all of our contractual commitments. It does include our contributions to PSPRS, public safety pensions. It does include still significant investment pool for employees, and it does include approximately $17 million a pool for supplemental requests from directors. However, that's all based on a $13 million deficit, so we've still got to get a lot of those decisions made and movement made there. So we will also go through that with you, but again, I'll draw your attention to the health benefits portion of today's meeting. That's the best guidance we need because we have open enrollment that will be starting in May. And so with that, we'll turn it over to Angel Ozomalam, our Business Services Director, to start the presentation.
All right, good afternoon, Mayor and Council. The table before you this afternoon offers a multi-year perspective on anticipated revenues, expenditures, and economic conditions that may impact city operations. It is from the base of these numbers that the city will develop a spending plan for fiscal 26 that would invariably impact future years, taking into account future spending needs, identifying fiscal challenges and opportunities. The forecast will evolve over the next month, as the city manager indicated, as we get closer to the submission of a fiscal year 26 recommended budget to Mayor and Council. The multi-year plan assumes that revenues and expenditures will grow annually at rates similar to recent growth trends. The plan does not account for risk of an economic downturn, the uncertainty of federal funding levels, nor the trade tariffs currently in effect. A slowdown in the economy could reduce key revenue sources, with shifts in federal policy or grant funding also creating funding gaps, if not timing gaps, in our anticipated resources. And of course, as we know, the trade tariffs would increase costs of goods and equipment as we go further down into this fiscal year and definitely negatively impact our numbers in fiscal 26. Included in the numbers is the fiscal 26 base budget for the unrestricted general fund. These figures include our base FY25 operating budget with minor revisions, plus a $17 million potential base increase, and that would cover our contractual commitments along with inflation adjustments. The city manager, as he indicated, is analyzing all of these issues and will present a recommended budget in the upcoming weeks. Some key takeaways from the 5-year plan before you are: 1, the projected operating deficit in fiscal 23 is estimated at $13.1 million compared to what was presented to Mayor and Council in the fiscal 25 budget. 5-year plan in the fiscal 25 budget, which was a total of $23.8 million deficit projected in fiscal 26. That $13 million shortfall, however, will need to be addressed when the city manager presents his proposed FY26 budget in April. Also included in these numbers is an unrestricted cash balance at the end of fiscal 26 of $7.5 million, which is significantly lower than last year's forecast of $23 million. We also are looking at a total of $44 million across 27 to 23 that would exceed the projected available cash balance. Annual deficits and negative cash balances are projected through fiscal 27 to 30, as we see on the board, 46.4 in 27 to 87.9 in fiscal 30. Therefore, there is work to be done in managing the resources of the city in order to raise the bottom line from the projected deficits in the out years. As part of the fiscal 26 base budget and 5-year financial forecast, we are prioritizing employee investments to enhance market competitiveness and pay equity. The initial draft budget, which for the numbers included in fiscal 26, include $17.8 million of salary adjustments and benefits, enhancing fair compensation and supporting workforce retention. This investment reflects the city's commitment to maintaining a skilled and motivated workforce that delivers high-quality services. As we continue to bring together the city manager's recommended budget, we are looking to manage the projected deficit and the projected year-end available fund balance deficits that are currently shown in fiscal 26 and future years. The recommended budget will be presented to Mayor and Council on April 22nd of 2025. We will also look at another issue that is included, or another topic included in the 5-year plan is the PSPRS, the Public Safety Personnel Retirement System contributions. Included in this slide are resources set aside to accommodate in part the city's unfunded liability within the PSPRS. The funding model was developed in collaboration with our pension consultants to guide financial planning in the general fund and the 115 trust for the next 5-year period. The model provides a structured approach to funding, and we have identified some factors that will warrant current consideration each year. The model, of course, assumes that there is stable investment returns and economic conditions, which may not necessarily align with actual market performances. It also includes, it does not take into account demographic trends, changes in demographic trends, employee retirement patterns, and other actuarial factors that could impact the accuracy of the model. Therefore, this is in part the reason that we're looking at the model over a 5-year period, even if the model is extended beyond the 5-year time frame. To mitigate these factors, we have incorporated in the model's projection within the next 5 years in the financial forecast an additional sum of money beyond the model's estimates to create a buffer between what the economy, the employee retirement trends would exact on the resources of the city. Also included in this 5-year forecast is particularly in fiscal 26, is the Tucson retirement system contribution, the city's contribution of approximately 27.5% of employees' salaries. There is no change, even though the board, the TSRS board, recommended increasing employee contribution rates in 26. The city manager recommends that we not adopt this adjustment and instead maintain the current rates for fiscal 26. We have provided a table on page 3 of the agenda memo that outlines the rates. We're looking at also the optimization of our operations for the reduction of expenditures and also delivery efficiencies and also delivery of service. We have on the board efficiency and reduction of cost in planning and the development services department. The department implemented measures to enhance efficiencies and cut costs. One of these measures is the cross-training of staff to streamline the permit review process by reducing overall review time and the number of personnel involved in the process. We will look at Tucson 311, where they sought to streamline city services and enhance public safety. The department streamlined services by directing non-emergency inquiries to appropriate resources like social services, transportation, and city services, therefore enhancing service efficiency and building trust in city operations. Tucson Police Department utilizes its Community Service Officers CSO program to expand community service to better balance non-emergency field work. Since January 2024, CSOs have responded to more than 60,000 calls from 911 and delivered over 65,000 hours of service, resulting in an estimated annual cost savings of over $3 million by shifting non-critical tasks from sworn officers. The department's professional staff investigator program, which was developed to support investigative functions by managing caseloads, have also helped expand community service within the department. Tucson Water implemented the short main program, where they sought to replace water lines of 12 inches or smaller that are in substandard failing conditions, therefore expediting the replacement of the high failure pipes that are at the top 1% likelihood of failure. Prop 407, Parks and Connection Programs. Our Parks and Recreations and Transportation and Mobility Department teams continue to work to deliver voter-approved Parks and Connection improvements through a combination of Prop 411, RTA, ARPA, and other grant funds. Overall, the city continues to progress in the delivery of efficient service to the community while implementing cost-saving measures. As you see on the board, the departments have taken additional steps to see that the city provides excellent service to the community while reducing costs in doing so.
Thanks, Angel. I am going to present to you at this time the city manager's recommendation for health insurance for the coming fiscal year. So we're going to pivot to the rest, basically the rest of the agenda materials, and it's kind of a weighty packet. I've got a number of slides for you. So again, we're asking for your indication to proceed with this recommendation today. Open enrollment for employees and retirees will begin on May 1st, and there's a lot of education materials that need updated in order to carry out the recommendations that you've got before you, and so we need the time to prepare those materials. I've had a couple of questions as we've gone through this process about health insurance, asking what our plan for employee education and retiree education is looking like. I can report to you today that we have a schedule of, right now, scheduled in-person meetings within departments, of 10 specific meetings. So we are making arrangements to go out into various departments, public safety, public works, HCD, as well as many all-city events. In-person opportunities for education are already on the books. We have, as well as in-person retiree events. And then we also have on the books 9 virtual events for open enrollment and education, as 2 of those are retiree only, so that we're able to answer and address retiree-specific complications and questions with open enrollment. We have, as well as we are arranging for one-on-one meeting availability with our health benefits team through the entire month of May, Monday through Friday. So May 1st through the 30th, the benefits office will be open and available for one-on-one meetings, and they'll be doing it in a computer lab situation, so a person can walk through and do their enrollment at that time. So that's the plan that's shaping up.
Anna, before you move on, you're extending the open enrollment period for maybe a week or 2? Because usually it's about a 2-week open enrollment period, which I love, by the way, because I think we did this back in 23, was it? That we did a lot of work to inform our employees and retirees about the differences in the plans and how much it would cost them.
Correct, Mayor. We are sticking, we used to have just a 2-week enrollment period, and this year it will be 4 weeks again. We found that extra time was really effective in us doing a lot of outreach events and giving people the time they need to come in, listen to the conversation, understand and absorb a lot of information about these plan choices, and then contemplate it and make a decision of their own. So we are sticking with a 4-year 4-year, 4-week, feels like 4 years, 4-week open enrollment period again this year.
That's great news.
Okay. Within our financial plans, we have approximately $4.8 million available for health benefit increases from the city. That's what we have baked into our financial models this year. As you know from our conversation at the last study session, and it repeated again in these materials, based on our estimates for health plan costs for the coming year, we would need a total increase of $7 to $10 million to move forward in the coming year without making any changes to our medical plans. And so this mismatch between what we have available and the amount of dollars that we would need to proceed without changing our plans is really why we've got to bring forward these recommendations for plan changes in front of you today. So the city manager has met with the Health Benefits Committee and heard their recommendation, as well as gotten feedback from you all, mayor and council, during our last study session, and is recommending a mix of changes that include increased contributions from the city. And as you'll see, the proposal will cost the city, it's $4.8 million. That is proposed to be infused into the plan here. The recommendation also includes increased premiums from employees. These are the amounts that everyone pays out of their paychecks, or for retirees, they pay it on a monthly basis to us. So everyone that participates in plans makes these premiums, and a number of those premiums will be going up in the coming year. In addition to those increases, we also need to make these changes in the medical plans, the plan designs, that will require the users of the medical plans and the prescription services to contribute more to those costs. It's the combination of these three different sources of funding and cost management that allow us to bring this in at an amount that's affordable within our financial plan. So on slide 4 here, and I've got a portion of this exhibit on another slide as well, so that it's a little bit more easily readable. You have the proposed plan design changes to all 3 of our plans, and these are shown in that red font. Is the proposed amount, and the strikeout version is the current amount. So you're able to see what we're recommending for plan changes for the coming year. In our network plan, there is a proposed increase in the deductible. What was $500 or $1,000 will move to a $750 or $1,500 deductible. You can kind of see how this schedule works. There is also an added co-insurance for certain services. You see a number of the items below in that column, inpatient hospital. There used to be 0 co-insurance after the deductible. That would be changing to 10% co-insurance after the deductible is met. And then there is a creation of Tier 4 for retail prescription drugs. And I've got the prescription drug portion of this chart on the second slide, but this is all in your Exhibit 2 to your packet. So those are the changes within the network plan. For our HRA plan, we are recommending an increase to the out-of-pocket maximum and coinsurance. We are recommending changes to prescription drugs to a coinsurance program from its current copay, and the creation of a Tier 4 for retail prescription drugs, as well as a decrease in the employer reimbursement account contribution. I'm going to move over to the bottom portion of the exhibit, and you can see that very bottom line city contribution. Currently, we were contributing that enhanced amount of $1,500 or $3,000 to the reimbursement accounts for those participating in the HRA plan. That is recommended to decrease to an amount of $500 or $1,000 for the coming year. And this is lower than it has been in the past, even before the enhanced amounts. That's the recommendation to get us to a cost-saving dollar that is affordable for us. I'm going to flip this back to talk about the HSA plan. Within the HSA plan, those last two columns, this plan is doing well on the affordability model. It does not need premium increases to cover coming costs, but we are making a recommendation, not changing any of the plan design for deductibles or coinsurance, but we are recommending the change to this plan to add that fourth tier for prescription drugs, so that all three of our plans have that retail specialty medication tier 4. And there's a recommendation to keep that enhanced city contribution that I'll talk about here in a minute. Another element of our recommended plan changes beyond the plan design is the change from in the employer-employee share. And this is all about total cost shift to stay competitive with other municipal employers around the state. So worked into this recommendation is the element that 1% of the total cost for the network and the HRA plans would move from the employer to the employees. And this would bring about a savings of $450,000 a year. Another element in the recommendation, as I previously mentioned, were the employer contributions to the health savings account plan. It was planned that our employer contribution for health savings accounts would drop this year from $1,500 for an individual and $3,000 for a family back to our previous levels of $1,000 for the individual and $2,000 for the family. After hearing from the mayor and council that incentivizing the HSA plan is an important goal, and because the HSA plan could support these enhanced amounts without a premium increase, the city manager is recommending that we continue with the enhanced health savings account amounts of $1,500 for individuals and $3,000 for families for employees enrolled in the health savings account plan for FY26. We would utilize the plan savings to pay for this at an added cost of about $1.3 million. And he's recommending that we look at the plan savings each year to see if the enhanced amounts could continue to be supported. Anything else?
It's tentative.
The recommendation also includes moving to self-funding for our dental PPO plan for fiscal 26. This is an element that will save us $247,000 for the year without making any changes, no increases needed for our dental PPO. There is a retiree dental DHMO increase. That's a 4% increase for retirees to choose to participate in that plan, and that's passed through to the retirees who select that plan. And then the last element of the recommendation is that city employees and their families be allowed to use city recreation facilities at no cost in fiscal 26. This recommendation is made to enhance employee and family health and wellness, and it's based on the Employee Benefits Committee's review of the issue and specifically the increased costs that might come about from this, with their note that it would be minimal increased cost to the city. We would be tracking utilization over the year to determine impact, and we still need to develop the specifics of the governance on this and eligibility for implementation, but we would be moving to try to get that all arranged and in place for July 1st. The city manager is also recommending that the Benefits Committee be tasked with studying the feasibility of closing our HRA plan as early as next year. So that would be for the fiscal 27 plan year. The suggestion is based on the significant cost increases that we've seen in that plan over the last couple of years, the declining enrollment that we see in that plan. If you remember, it's a small, I think about 10% of our members enroll in that plan. And given the increased flexibility that most people can achieve by enrolling in a health savings account rather than a health reimbursement arrangement. Because the HRA plan might not be offered in future years, we want to take this time, and we'll be adding this piece to our education for employees this year to encourage employees and retirees who are currently in that plan and might have reimbursement account balances in that plan to begin to utilize those balances. When the plan is closed, those balances would go away. And so we want to start talking to people and letting them know that that plan might not exist in the future. So use what you've got in your reimbursement account if you can. The cost of the recommendation in total, as I've said, the total costs are $4.83 million increase for the city over the previous year's medical amounts, and those amounts are within our financial forecasts. We have included a number of exhibits in our materials that describe the impact of these changes for employees and retirees. So exhibits 3 and 4 show the recommended premiums for the coming year, as well as per paycheck impact, the change or the change in the premium increases for employees. And I haven't replicated all of those exhibits in the slides, but I did want to talk about what is Exhibit 5, I believe, where we show the employee paycheck impact for employees that stay in their same enrollment. So this is a question that we get a lot from employees. Okay, so what does this mean to me? If I'm currently enrolled with my family in the network plan, and I currently make $60,000 a year or less, we're going to refer to the top box and the far left column. What'll that do to my paycheck? So this table shows you that if you earn less than $60,000 a year in base pay, and you are an employee with family, that's EE plus FAM, and you're on the network plan and you stay in the network plan, the amount that you'll contribute in your paycheck is going to increase $30.86 each paycheck.
So the $30 is the increase, not the total
the premium.
amount.
Correct. This table also shows you, and it's important information, but it's all zeros. It does point out that for people who are enrolled in the health savings account plan and want to stay in the health savings account plan, you will have no increase in premium. That plan stays the same price in the coming year as it is this year. And that's why you see all of the blanks at the bottom of this table. And you kind of have your varying amounts. There are increases within the HRA plan as well. Also on this exhibit at the bottom portion of the page, we do show the savings that can be achieved when you're moving from the network plan to the HSA plan. And so that's why on this table under HSA, it's giving you negative amounts. And the way you read this table is, if I'm currently enrolled in the network plan, I'm going to say employee making less than $60,000 a year. If I'm just covering myself, I'll stick in that EE box, employee only. If I'm in the network plan right now, and for the coming year, I want to move to the health savings account plan, the amount that I pay on my paycheck will decrease by $34.44. That's the savings I'm going to see in my paycheck by changing plans. The same would be true if you are an employee who covers your entire family with our plans, you're currently in the network plan, and you're switching to the health savings account plan, and you make less than $60,000 a year, your paycheck amount contribution will decrease by $73.87 for every paycheck. These are the amounts that we talk to employees about considering funding their health savings account with if they decide to move from the network plan to a health savings account plan. A good idea to invest some or all of your premium savings in your savings account. So those are part of what you'll hear us talking about at the enrollment and education sessions. Little bit, let's see, I want to make sure I've covered, there's one other thing before I move off of health insurance, and that's just to get back to you about the questions that you posed to us about prescription drugs, letting you know. The questions that came up during the last session that we had, we've been working on putting information together, but we haven't gotten it out to you. But I want to let you know what's coming. So we will have for you the list of specialty drugs that constitute the 10 highest dollar spend within our plans. And we're also preparing for you, our consultant is helping us with a list of drugs that over the next, I think it's 12 to 24 months, will be rolling out. I call it rolling out a generic anymore. I think they're called biosimilar drugs, but drugs that will have generic options coming on the market in the next year or two. And those are important things for us as we're estimating costs when we have, when we're in a situation where there is no biosimilar alternative for a drug and you're required to purchase more expensive branded drugs. When those drugs when a generic option becomes available, there can be quite a bit of plan savings, as well as savings to the individual who's paying a portion of their prescription drugs. So we will have that information for you probably within the next couple of days, and you'll be receiving information about the total costs that the plan spends on those drugs, as well as the savings that we might be able to achieve when generic or biosimilar alternatives become available. And I think that's all that I have on health insurance. I'll wrap up just by talking a little bit about our budget engagement event that we had yesterday. So we have been talking about engagement as we've been meeting during study sessions. Yesterday was, I think, a great event, and thank you to all of you that were able to attend it or send your staff members. It was our employee budget engagement town hall. We had over 130 participants attend, which I think is an increase from last year, which was great. The event was at the TCC in person. We did record the event. It lasted, I think, about 90 minutes. There was a presentation by the city manager. There was live Q&A session, which was great. And there was a feedback survey that was facilitated during the event itself. We have just sent out this afternoon a notice to all employees with the city that with a link to where they can view the live recording and the survey as well, because we're leaving the survey open for the next 48 hours to try to gather more feedback from people that other employees that weren't able to attend the event. So at a future study session meeting, we'll be sharing that feedback with you. Anything else? Okay. We've also included in the memo just an update on our calendars, both for the compensation plan and the budget. Dates have not changed on the compensation plan, except we have firmed up the date of the mayor's hearing on compensation plan disputes. That now has a date of April 14th, and the budget calendar dates remain the same. And that's what we have for you this afternoon. Thank you.
Thank you, and I really appreciate it, and I do appreciate the city managers heeding the call from mayor and council about keeping the incentive rate for the HSA, which keeps it at $3,000 per family and $1,500 per individual. That was also the recommendation of the budget, the benefits committee, so really, really appreciate that. I guess my question is, in our previous budget memo, you had shown us the percentage increase of our health insurance plans, and they were up in the 20s. So what exactly made our plans so 20%? Usually we were experiencing 8% increase, sometimes it was a little less. Why 20% increase in our health insurance costs?
Thank you, Mayor. I believe it's a mixture of items. The standout item for us this year, though, has been prescription drugs. And you'll see that in the information that we get out to you regarding the specifics. In total, our consultants are letting us know, in general, around the country, prescription drugs costs were increasing around that 13% level. Within our plans, we saw an actual increase of almost 20% for prescription drug costs. And I just think utilization of prescription drugs, we are trending higher than national averages. And so that is a big piece of what's driving costs within our plans.
Are there ways or methods that we as a city of Tucson and our employees can use to tap into less expensive prescription drugs? Like I know that certain pharmacies, convenient use pharmacies, charge more than other places. So do we have any planning efforts in terms of informing our employees? What are the locations and, stores or online stores that provide less expensive prescription drugs?
I think it is point taken. We need to do more specific education about prescription drug costs at the individual employee level. And to be honest with you, I don't know how much of that is happening during open enrollment. It's really something that we need to be doing throughout the year. And so, point taken, we need to do that. Linda Kyle is in the room here, our health benefits administrator. And so I think we need to incorporate more of that work. We do know that Costco is one of the lower cost places to purchase prescription drugs, and the Costco pharmacy is in network for our network plan. And so that is, I think, one of the better recommendations that we have for employees, and that I'm told by our consultants as well as Cigna, that's a good place to go to get low-cost prescription drugs. One of the other items that you'll see, one of our highest cost our highest cost drugs also has a biosimilar option. And so I think conversations with employees and some of the changes that we're making to these tiers can incentivize our employees within our plans for choosing the lower cost option. It saves them money as well as saving the plan money if they can use a biosimilar. And so those are some of the things that we're trying to do to help contain costs and give people true options that can save them money as well as save the plan's money.
All right, do you need a motion to proceed with your recommendations, Mr. Manager?
Yes, Mayor, that would be an excellent outcome for today.
So we can, if I can have one of my colleagues consider a motion to proceed.
So moved.
Okay, so there's a motion to proceed with city manager recommendations. There's a second. Now we can discuss and ask questions, and if the motion needs to be amended, we can do that. Councilwoman Lee, and then Councilmember Cunningham, and then Councilmember Fimbres, you have your hand up as well, and then the Vice Mayor.
Okay, thank you, Mayor. I'll try to be brief. I do have a few notes to go through, though. Appreciate you prefacing everything with the projections. There's a lot of economic uncertainty. We don't know what's going to be happening there, so appreciate you all working and helping us navigate through that. I love the $17.8 million built into the budget to invest in our employees, especially around wage parity and making sure that we're being competitive and showing our employees that we value them. So thank you so much for building that in. I also really love the fact that city employees and families are going to get to use our own facilities. Just a thing, it would be great if we have, like, let's say an adult child who's still at home in college, they could go to the gym, because my son would really love that. Just throwing that out there. But he is still on our health insurance plan. So that would be great. So I love that. And I will say that, for folks listening, and are considering the cost increases. I have a spouse that has employer or health benefits available. Many of us probably do have partners that have health benefits available, and every year we compare, and the city still provides one of the best plans and covers so much of the cost compared to what other employers are offering. So I just want to throw that out there that we, it sucks to have to pass costs on to our employees. Comparing it with other, even local employers, I think we're still offering a really good plan to our employees. Noted on the fiscal 26 efficiencies, planning and development services and other areas where we're going to try to realize those efficiencies. With everything happening in the federal government, I hope that we can just take a very people-centered approach to how we're going to find these efficiencies, because there's just a lot of uncertainty out there with people's work and their jobs. So I just really want to put that out there, that hopefully we can do this in a very people-centered way without compromising our service delivery, our timelines. I'm definitely concerned on PTSD when we talk about any changes to that and still being able to meet our expectations out to the community. So just wanted to say that. And then we've got Prop 407 on there. So obviously just want to put out there, we still got to deliver on what we promised, regardless of how we're going to find those efficiencies. But appreciate you all coming up with a way to get us down to 13 million in the hole instead of a larger number. With respect to HSAs, I know I always ask about what is our goal? How many folks do we want to try to get over from the network plan to the HSA to help it pencil out a little bit? So were you able to find out anything that might help us with that going into an open enrollment?
Thank you, Mayor, Councilmember Lee. Yes, I think one of the ways to frame a goal for continued migration into the health savings account plan is really looking at the people that we have enrolled in our plans who aren't using a lot of their medical benefits. And looking at our current information, we do have hundreds of employees who are enrolled in the network plan, so our highest cost plan, they're paying the largest premiums, who have not used any medical benefits for the first 6 months of the plan year. And so those folks, if they don't have a need to use the medical benefits, those are the people that I think are the great candidates for educating and having conversations about plan choice. And so our recent numbers are there are over 750 of those folks that fall into that category for the months of July through December. And so there is room still for continued substantial migration into the health savings account plan. I think it's a part of our education effort.
Mm-hmm. Thank you for getting those numbers. I think that's a really great way to frame it up. And if you're one of the 750 people, like, we need y'all to get your physicals and your mammograms and your colonoscopies, because that's really important. And there are incentives through the plan, wellness incentives through the plan. If you get your physical, they'll get you a debit card. So definitely, that's super helpful. Appreciate keeping the HSA incentive where it is. One thing I'm curious about, and the mayor kind of talked about the percentages already, we know that the network plan was a 20.1% increase and HRA was 22.9. We know that we're investing $4.8 million toward those costs. Do we know how that breaks down percentage-wise? So of the 20%, how much is the city absorbing versus the employee? Because I expect that's going to come up as a question.
Mayor and council members, that's different for each plan. We can look at breaking it out that way. It will also depend on the enrollment, but we're estimating those things right now, so I can get those numbers for you in the future. Okay. I don't have them off the top of my head.
Sometimes that comes up. And then lastly, with the HRA plan, I appreciate giving plenty of time for folks to consider different plans and spend down those HRA funds that are in that account that they can't really do anything with other than healthcare reimbursement. And then just one random question before I be quiet, Mayor, is government shutdown pending, possibly federal government shutdown on the 14th on Friday. Do we know if there's anything that we need to be thinking about that could be an impact of federal government shutdown for a couple weeks? And that's my last question, Mayor.
Honorable Mayor, members of the council, for us, a government shutdown for a couple of weeks is something that wouldn't affect our day-to-day operations immediately. And in fact, we're already operating in sort of a scarcity mentality because of a lot of our federal funding sources have been on and off. Depending on what day of the week we try to access them. So we've already sort of had to adapt to a little bit of, of patience and calmness when it comes to that. If it's a couple of weeks, we're not expecting significant impacts, but we would start to see project delays that would be forthcoming when our federal partners, not even just from a funding standpoint, but our regulatory agencies, our folks that approve things that we are trying to proceed with, we've already seen a significant slowdown in the responsiveness on many projects. Our ability to get a yes to proceed on certain things has already been significantly delayed. So I think that mode's already occurring, and a shutdown would just extend it for us.
All righty, and I think it was Councilmember Cunningham, and then Councilmember Fimbres, and then the Vice Mayor.
We've talked about the HRA changes before, and every single time we talk about them, we get to almost to the finish line, and then it backfires because a whole bunch of people show up and say they didn't know. So I'm actually think it's a very prudent financial decision long term. This is what I ask. We get the easy ones first, where we send out the letter and they sign the acknowledgement and stuff like that. But the ones who don't, I want like emails, certified letters, and a one-on-one Zoom meeting for anybody who doesn't want to do it. And we just need to tell them it's happening. I just don't want anyone to be able to call and say, oh, I didn't know we were going to end the HRA. I just don't. I mean, the one person who does, everyone on this side of the table will know that they got a certified letter, they got 4 emails sent, and they got attempted Zoom meetings to be told exactly what was going on verbally. I mean, we can't leave any doubt that we didn't tell people 18 months ahead. It's really the execution that matters, the execution of the plan rather than the plan itself. So I want to just make sure that that HRA piece happens. The second thing is, and this is, I tell you guys this every year. No one's ever going to listen to me, but that's okay. I'm still going to do it every year. And that is that when we go through these percentage changes and we just plug in percentages, we don't have to do it that way. We can switch to round numbers. We can round $13.50 down to $10 and $34 to $30 and round up $65 to $70 so that we are speaking in round and easy to remember numbers. That way, if everybody was saving from the employees only to the employees with kids, to the employees with family, to the employees with special, if all those applied, you could be able to say, well, you're saving $75 if you switch to HSA. It would be a lot easier for people to remember. It's like customer friendly. We just had this discussion with the pools where we have 18 pools with different days at different times. If a pool is open the same 5 days a week consecutively at the same times, it's easy to remember and it's very customer friendly. It's like making an easy to use website. So what I tell you is, think about that next year to the benefits committee. Why don't we look at round numbers and rounding up and rounding down so that there's savings? There's no law that says you have to keep the HSA contribution the same. It could have been reduced. And then all of a sudden, people who have not bought into the HSA idea, which at this point, I think like 5 out of 6 out of 7 of us are doing it. So at least we've all put our money where our mouth is. So at least you just say, hey, look, they're actually going down on this other one. So, I mean, it's going to even out because ultimately the more people that use HSA, the more the city contribution is going to go through. But still, over time, it's going to save us a significant amount. Really quick, just curiosity. So the use of city facilities, does that include the city dependents?
Honorable Mayor, members of the council, we haven't done the governance yet, but our intent would be to have dependents that are on a city health care plan would be eligible.
So they'd use like their health care card to get in or something to that effect. That makes sense. I think that's a good way to do it.
Councilmember Fimbres.
Thank you, Madam Mayor. First, I want to thank Tim and Ann and Rosemary for their putting on yesterday's employee budget town hall. Very well attended, I hear. Allowed our employees to learn and provide input on the budget process. I heard very good things about it yesterday from Mary Kuchar and from Gabe Gabriel Holguin, who attended it yesterday for my staff. What are labor groups? What's the other feedback from other labor groups? Do you know about?
Honorable Mayor, members of the council, Councilmember Fimbres, feedback from the labor groups, both at the event and then in our ongoing conversations, has been positive. There were a number of labor groups had representatives at the budget town hall yesterday. We had members of the city while Anna and I were up front delivering presentations, we had other members of the city manager's office dispersed throughout the crowd and sitting at virtually every table. So there was a lot of positive feedback from the labor groups that were represented there. The biggest question on people's minds is about compensation, and the questions that were asked certainly centered in on those issues. But I think the most feedback that I heard was people felt it was a valuable use of their time, and they felt like they were heard.
Alrighty, Councilmember Fimbres. Vice Mayor Santa Cruz.
Thank you, Mayor. I also had the opportunity to attend the town hall yesterday, and it was just great to hear the presentation from the city manager and staff, and to kind of gauge the energy of employees there. I think I'm not sure how we do this. I just wanted to make sure that our city employees are able to attend without having to take time off, that be paid participation of them getting to hear from the budget. I had a question about what does Tier 4 mean on the pharmaceutical piece? That wasn't very clear to me.
So, Mayor and Council, I'm going to ask Linda Kyle to come and give you some more information about this specialty drug Tier 4.
Hi, thank you for having me here. So specialty medication is the Tier 4. So we've got our, just a quick overview. Tier 1 is our generic medication. Tier 2 is our formulary brand. And Tier 3 is our non-formulary brand. Tier 4 would be the specialty medications that Anna had discussed. So specialty medications are going to be your higher cost medications. We actually, Cigna has a specialty pharmacy that they work with directly for those specialty medications that are typically going to be passed on to the provider to administer the medications. And so there's just different variables that go with it, but really what it comes down to is it's the higher cost medications.
Could you give me an example of a specialty medication?
Yes, so also on that list, one of the lists that Anna had provided is the Humira. Humira is one of them, and that right off the top, because I know it's on the top of the list, but yes, that is one of them. And so I didn't bring my laptop up with me, but I can give you some other names as well. But that is on the list that was provided to you.
So maybe cancer medication or?
I'm sorry, say that again.
Like what type of medication? Is it for
insulin
cancer?
or
Is it insulin? Is it Ozempic? What is that specialty medication?
Yes, let me get that really quickly. And I can
Okay. Thank you, no problem.
I think while we're waiting for that, I'm curious on the dental, the self-insured. I would say that most of my HSA funds with my 4 kids all go to dental. Whether it's braces or cavities or just, whatever, cleanups they need. And so what is that, what are the implications of that? What does that look like? Because I'm still confused. I know we moved into a self-insured, just our healthcare generally, thinking that was going to bring us cost savings over time. And I'm not like, are we saving money? Like, would we be worse off if we were still, just under Cigna? Because the reason I love the self-insured is thinking like, future of what that could mean for our community. I know Councilmember Cunningham has talked about having health insurance for all our kids in the city of Tucson, and that would be an opportunity to do that kind of programming. So I'm just still curious, what does that mean overall? And then I still would really like us to explore having a city-county pharmacy for our employees and how we can make that happen to have some cost savings.
So Mayor and council member, as far as the self-funded dental portion goes, so this very much, as you're describing, is meant to set us up for future opportunities. Right now, with the dental coverage, what we're doing, what we've done in the past, is we have gone and sought insurance coverage with an insurer, and we pay them a specific premium for that every month or every paycheck for the employees or retirees. Moving to a self-funded model means that we're not buying insurance from a third party. You remove the profit element from that component, the cost of the program. In other words, when an insurance company is selling you insurance, they're covering all your claims, all the administration costs, and they're deriving profit for their shareholders, for their company. So going to a self-funded model means that we're accumulating our own resources in our own funds. We're paying the claims, we're paying the administrative costs, but we aren't paying a profit model. And to the levels that we can lower administrative costs and control claims costs, we retain that money and that savings for ourselves. When you're buying insurance, if you're lowering claims costs, all of that goes to benefit the insurance company and not you, the purchaser of the insurance. We've been doing that with medical for a number of years. We're proposing to do that with dental. We do have two elements of dental insurance. One is the PPO, and the other is an HMO. We can self-fund on the PPO. That's what we're suggesting we do this year. We can do it at the current rates without making any plan changes, so the benefits will stay the same. We don't need a premium increase, and we can achieve savings of that profit element of about $250,000 is what we're expecting for the coming year. We can't do it with the dental HMO piece. The committee knows that, and they want to kind of spend the next year working out how we could get to something equivalent to a self-funded, self-insured dental HMO as well. So that's probably coming. What it allows us to do also when we're self-funded is we can make plan design changes in future years. When you're just buying insurance, you're kind of stuck with a renewal, a price that comes literally out of the blue. It can be, double-digit premium increases, and you don't have this opportunity to make plan design changes. So we're really trying to work ourselves into a position where we can have more control, more benefit over how those dental plans, what they cover, and really make good use of the dollars that we're investing in dental benefits.
The last question that the Vice Mayor asked was, would we be able to transition into doing our own pharmacy? If we're self-insured, can we can we self-purchase?
Purchase, yeah.
I don't
Yeah,
know how to say it.
Okay.
But create our own, pharmacy, maybe in collaboration or partnership with a local clinic or hospital so that we could save money. I mean, we're trying to, if 20%, and we've been hearing for the last 2 years, right, that prescription drugs had been inflated, many of them inflated without any really, out of the blue, right? We didn't know why, except for the bottom line for the company. So is there a possibility or a path to prescription drugs for our employees?
So the path that I'm aware of, the piece that the committee has explored in the past and that the city has explored in the past was related to setting up our own medical clinics as well. And we had received a proposal from Cigna to do that a number of years ago. When we looked at the cost to do it, it wasn't in the bottom line a cost savings to the city. And some of that was due to the fact that we're a big group, but we're not a huge group, and we certainly don't have a population that would be using one pharmacy or, sort of the logistics about how many people would use that site and how would we go about setting that up? It wasn't a cost savings. That wasn't analyzed just as a single standalone pharmacy issue. It was with a number of other services. And so we have not worked on any other path on that issue to a separate pharmacy. I'm not going to say that there are not options. We haven't fully explored them.
I know that we had explored the idea of collaborating with El Rio Clinic. And I know that El Rio has pharmacies that, and I don't know how that works, but anyway, I just wonder if that's a path towards less expensive prescription drugs.
Honorable Mayor, members of the council, we'll add that to our study for the next year. Both of these, doing a city or city-county pharmacy and/or other collaborations. As noted, some of that's been studied in the past. It hasn't risen to the point where there's a business case yet, but we'll dust it off so we can make sure that we're looking at current dollars to current dollars. And also just have also had some discussions with County Administrator Jan Lesher about is there any appetite to look at the city and the county collaborating more on healthcare. The point of it is, though, when we go to look at the business case, Cigna has yet to be presented us to a business case where there'd be any savings for the city or the county. So it sounds good, and we'll continue to have those dialogues, but we've yet to be presented with something that actually saves dollars.
Yeah, of course they're not going to present us with that. You're going to tell us some examples of the...
Yes, so some of the examples on specialty medications is the Humira, as I had mentioned. And then you had asked about the diabetic. So yes, you've got your GLP-1s that are included in that, which is Ozempic, Mounjaro, Trulicity. So there's just a couple of the examples from the diabetic piece of it. But again, too, just different conditions have these specialty medications. So you've got some that fall under cancer and psoriasis, just arthritis, stuff like that.
Okay. Was someone else in line for questions? Alrighty, I wanted to bring up an issue that we have heard like maybe a couple of meetings ago, and I emailed you some questions about the Suntran employees. I think that some labor groups and employee groups have brought to our attention that Suntran employees received a very generous network healthcare benefit from Suntran. Can you describe the difference between the considerations that have been made for Suntran employees in fiscal year 26 and what the difference is between City of Tucson employees and Suntran employees and this benefit?
Sure, Mayor, I will do my best. So Suntran employees work for Tucson Transit Management, LLC, and they're not employees of the City of Tucson. So we don't have a lot of deep understanding of their medical benefits, but we have spent some time looking at information that we've been provided about their plan, as well as the amounts that are paid supplied by their employer for monthly premiums. The written agreement that Tucson Transit Management holds with the Teamsters Local 104 requires a per employee payment of a flat dollar amount for health care each month for those employees. And just checking in with Director Credio, he said his understanding is they've got a little over 450 employees currently. They're authorized for up to, I think, 509 employees. The current health benefit agreement with Teamsters began in July of 2021 and ends in June of 2026. It was a very long-term agreement, a 5-year agreement regarding medical benefits. Our analysis of their plan information shows that the plan offered to Suntran's Teamsters is similar in benefit design to the city's network plan, and does not require Teamster employees to contribute premiums. based on the amounts paid by the employer, it has a cost that is similar to the city-paid portion of our network premium. The cost to the operation per employee is roughly equivalent to the amounts that the city provides its employees enrolled in the network plan. There's also a number of Suntran employees that are in administrative roles who work for Tucson Transit Management LLC. They're not Teamster members. For those administrative employees earning less than $50,000 a year, they also receive employee-only coverage that doesn't require the employee to contribute any premiums. But if they've got children or a spouse or their whole family covered, they then have to contribute to the premium. All other administrative employees of Suntran are required to contribute anywhere from 1 to 19% in the monthly premiums for their coverage. So that's the information that we were able to gather in studying that.
Okay, the other question I had regarding union work is, again, another couple of meetings back, CWA employees at Housing Community Development Department came to talk to mayor and council about pay disparities between the same range of employees. And this is something that I know had been discussed at HCD with CWA, including a CWA representative. Can you expand on what are the concerns that you've been hearing, and what are the actions in response to those concerns?
Honorable Mayor, members of the council, so that issue that was coming up is about in-range pay placement. That's the words that we're using, and that is an element of the $17.8 million that we've put on the table as a placeholder for the FY26 budget. So specific to CWA, we've had numerous conversations with them. Our Libra team meets with them on a monthly basis at minimum. I join those meetings at every other month. On January 21st of this year, HCD leadership and HR department staff met with housing office staff for a listening session with approximately 15 staff in attendance, and the CWA representative, Linda Hatfield. That covered their concerns about workload and compensation. On January 27th, the HR director and deputy director met with Ms. Hatfield again to discuss the FY26 compensation plan. So a lot of the information that I shared with the employees at the town hall yesterday was being shared with CWA as early as late January, including this issue over in-range pay placement. And we've been setting the target for addressing it over at least the next 2 years, because we know there would be an ability to do certain things FY26, assuming we can get the deficit down to zero and preserve the compensation dollars. But we know that anytime you're doing a systemic adjustment like that, you know you're going to have to do a round two, because you don't get it perfect the first time. And then there were several additional meetings through February with HR staff and CWA and membership talking about these very issues. And then, as we mentioned just yesterday, we had the employee town hall. We did have CAWA membership present there, and actually a couple of questions from self-identified CWA members, where again I reiterated the in-range pay placement as a goal. As far as actions taken, the actions taken so far have been to put together a plan that we can bring to you for adoption with your budget for FY26 to start to address in-range pay placement. So that is where we're at right now, and within the next 2 or study sessions, we'll really emphasize this compensation part of the discussion so that you'd have the tool in your toolbox to be able to start to address it.
So in your opinion, since January, conversations between CWA, HCD employees, and HCD management and administration have been taking place, and in your upcoming proposal for the budget, you feel that we are attentive and putting money towards that pay disparity that we have been presented with?
Yes, Honorable Mayor, both of those statements are correct.
Okay. For me, I just have some questions about our budget regarding the percentages of money that go to our city charter services. Because we're hearing a lot of misinformation out there. And so I want to clarify, if you may, about the percentages of money used for our general fund for public safety and charter core services. So we're hearing different percentages out there in the community about how much money of our general funds goes to public safety. Can you clarify that for us?
Honorable Mayor, members of the council, I can do my best. What I'll start with is, that is a common question. And when you look at our general fund, it's complicated. So people often have a desire to understand where the money goes and how it's spent. I step back to the overall city budget of $2.4 billion. We've said a number of times, most of those revenues are restricted. Tucson water rates go to do Tucson water. Housing dollars from the federal government go to do housing. So when you look at our ability to fund public safety, other than some grants from the federal government, it predominantly comes from the general fund. The round number we use on the general fund is around $750 million. As you see, it'll go up year over year when we look at the forecast. But of that $750 million, the predominant amount of that money does go to fund public safety. So when we look at trying to say how much does police funding get, how much fire funding get, and especially to compare us to other cities, you really have to dive deep in order to make sure you're comparing apples to apples, not apples to oranges or different types of apples to each other. So if you look at a share of a general fund for a city going to police per se, you have to understand a couple things. One, are there pension costs included in that line item? In our case, they're not. They're in a different line item. Is their 911 service funded out of the general fund in police, or is it funded as a separate department like it is in the city of Tucson? Do they get one-time dollars? So even our own folks, when they would look at how does Tucson compare, they might throw out a number like 30% of the general fund goes to TPD. My number's 40%, and I'll explain why. The 30% doesn't include 911, right? It includes a portion of the pension, but not the debt service on the cops the pension obligation bonds that we took out to service our PSPRS unfunded liability. It includes none of the Prop 101 dollars. It includes none of the general fund investment plan dollars that are spent. So and it also, the other thing I would point out is it doesn't include all the essential services they get from other departments that we don't charge out between department like we used to. So for example, one city might have IT needs for their police department funded in their police department. We don't. We fund it in our IT department. So when you look at those cost allocations, I'd say we're very much on point with what peer cities do as far as a percentage of their general fund. I would peg it at 40%, even though others might say it's 30%, and I've explained why. You're not accounting for everything when you take one line item out of the budget that says police and say that's what you're funding. When you add another 22% for fire, and you really look at the total general fund, and I just look at, just putting this together pretty quickly, what we spend on fire, a little bit on general services. You got to have vehicles, you got to have places for people to do things, lights. You add in Parks and Recreation, one of our core charter responsibilities. You add in Public Safety Communications, which is a separate department. And then I'm going to talk about PDSD in a minute. You get close to 80% of the general fund goes to just those services. I'd also point out, when you look at the total general fund and what a percentage goes to it, some cities have their planning development services as an enterprise fund. It's a separate fund. We fund those revenues into the general fund and the costs out of the general fund. Some of them carve it out and they run it like Tucson Water. So you really have to, the numerators and the denominators matter. You got to really go apples to apples. And I'd say we stack up pretty competitively as far as the percentage of our general fund that goes to police and fire.
And then, of course, you know, we're hearing in this time as well, just give me the budget. I'll tell you what to cut, right? Very Elon Musky. Elon Musky, we'll tell you what to cut. Other than cutting fire, police, parks, and recreation, roads, and housing, how much room is there to make cuts or create efficiencies in our general fund budget? For example, we're, you know, possibly getting hit next fiscal year with a $48 million budget deficit. How do we cut from our general fund if we don't want police and fire and core services affected?
Honorable Mayor, members of the council, that last part of your sentence was the most impactful to me. If we don't want to cut core services. If we don't want to cut core services, there's very little, if any, ability to rearrange funding within the general fund. The things that it takes to run a city include a board of directors like yourselves that is funded out of the general fund. We have a city court, we have a city manager, we have a city attorney, we have information technology, we have business services. These are all things that are either core services or indirectly to core services. And the vast majority of the general fund is personnel. So if the question is, how do we find more money for firefighters? Well, you can lay off a bunch of police and go hire your firefighters. That's essentially what balancing the general fund looks like right now. In the past, there have been decisions made in dire economic times to really gut core services like parks and recreation and other things. We now spend a little bit of our general fund money on roads, but there's as many people saying you should put general fund money into roads as there are people saying you should put more into housing or other things. The truth of the matter is we put very little into roads out of the general fund. So the demands on the general fund far exceed what it can produce, and the ability to doge your way through it means you would just simply stop doing things that are core services in order to fund others.
Well, to me, it's very rich to hear from past elected officials or those that have served in council offices to say, well, back in 2002, we cut $100 million from the general fund. Well, we are residents and this mayor and council are having to catch up for the many years those council people decided to cut and cut and cut and cut. This mayor and council is finding solutions because of those decades worth of disinvestment into our parks, into our roads, into paying our police and fire living and decent wages. This mayor and council presided over a historic wage increase for police, fire, and every City of Tucson employee because of the lack of action that other mayor and councils had done before us. So one way or the other, the services provided to the residents of Tucson are going to suffer, right? You either pay for it now or you try and catch up 30 years from now. So I'm just thinking about how cutting our budget haphazardly without any focused strategy is not a good idea because we're going to have to pay for it now or into the future. And it has taken this mayor and council at least 8 years to catch up, and there's still some catching up to do. And so decades of disinvestment because of previous mayor and councils deciding to just cut is impacting. We could see that in our roads, right? Not when people elected Regina Romero did our roads start crumbling. Those took decades to get to how they were. When I started as mayor, 80% of our residential roads were absolutely failing. And we've been able to cut that failure of roads, residential roads, by more than 20% because of Proposition 411 and this mayor and council putting that on the ballot. So, you know, I just wanted to talk some facts here and disprove some of the misinformation that is being shared, and just needed to make sure that you know, that we had a clear and informed and fact-based conversation about our budget. Another thing that I would encourage people that are saying, you know, hey, we can cut $50 million from the budget. Our budgets are public information. They are on our websites. You can print out the budget as a individual, a resident of the city of Tucson. Even if you live in the foothills, you can print it out and give us input as to where exactly you think we should cut. So I invite anyone in the community to tell us where we should cut. And we will consider it just like we consider every single resident that gives us input on how we budget as the governing board of this organization. Councilmember Ulick and then Vice Mayor.
Yeah, I appreciate your comments, Mayor, and I too have seen that feedback, and you know, I think it was also cited the recession in 2008, 2009. Many of us were at the table, including Councilmember Fimbres. We did have to lay employees off. We did have to make cuts to services. And what I'm hearing from our community is not do less, it's we need more, you know. We need to improve and enhance what we're doing in order to meet their needs. So, but I agree with you as well that if there are ideas, I mean, when I came in, when did I come in? It was about 8 months ago or something. You know, I totally peppered everybody with, well, what about this and what about that? And I looked at every revenue source we could charge under the Model Cities tax code, and I said, well, let's sell this building and let's do this. And the thing that I was so impressed with is there was no surprise to anybody on our team because so much had already been discussed and vetted, and I appreciate their patience with my insistent, well, yeah, but, so I get that feeling like, well, I can find that nugget. We welcome anybody to point to those nuggets because they're tough to find.
Alrighty, Tim, and then Vice Mayor.
Thank you for that. And what I will add, and that's a great point, that doesn't mean we sit here and say there's nothing we can do. We do this literally every day. And a little bit more reflection back on the employee town hall from yesterday. We did have part of that where folks, we were really trying to solicit those nuggets. And we had a lot of comments that came in, and somebody would say do this and somebody would say do the opposite. You know, there in any group of 200 people, you're going to get a lot of input that, you know, reinforces certain things we're doing or says rethink it. But what I'm estimating is about 1 out of 10 of those is one of those nuggets that if we polish it and dust it off and look at it, perhaps we can squeeze some savings out of that. So that's going to be our follow-up work from the town hall. It's not just we had it and here's what they said. That is our marching orders to go forward and look at all those ideas and see what we can do to wring some value out of them. Thank you.
Vice Mayor.
Yes, I love that idea that one of the employees brought about having that suggestion box again that's just ongoing. And it can be the budget or it can be different things. And I think it's just a way to have that input, output, you know, from employees. I also agree with the mayor and council member Ulick. I think we're still paying for all the cuts that happened during the recession, all the decay in our infrastructure, whether our parks or our buildings, are a result of no maintenance or not taking care of that. So that is a debt that we just passed on to future taxpayers, a future mayor and council to have to deal with. So that's where we're at right now. I think it would be helpful, and I know this is always what I'm like, how are we more like transparent or educational about our budget? And I think it's important what you said, Tim, that like maybe you can look at something and be like, it's 30%, but that's not taking into account all these other pieces, other interdepartmental, the PSPRS, all that. I think it would be so helpful if we're having these like public safety categories and everything that falls under that, to then get to the percentages that we can show out to the public. This is actually how much gets invested into public safety. This is how much gets invested into our parks. And then even all the supportive, like you're talking about the general services or IT, that a lot of us don't think of that as, you know, public safety, but it's critical infrastructure to make sure that we're being responsive and meeting needs. I think that would be helpful, even for us to share in our newsletters, on our websites. I think the more tools we have to help educate ourselves and others will be very helpful.
And we still have to be at a point where we're not out of the woods, right? There's next fiscal year, there's a possibility of seeing a $43 million budget deficit. And we do not know how the federal cuts will and freezes, and we do not know how it's going to affect our departments. So we have to be able to, be prepared for anything as we move through these incredibly difficult and chaotic times where we don't know how the federal government is going to fund or not fund our housing assistant programs, et cetera. So we continue working on as carefully as we possibly can to make sure that we continue delivering excellent services to our community, that we continue moving forward. And to be honest with you, I have seen in the last 10 years sitting at this table that Tucsonans have decided to invest in ourselves. And that's why I think that the success of Proposition 101, Prop 407, Prop 411, all of these initiatives that have been brought forward to Tucsonans have been part of that strategy that we've had here at this table to continue investing in ourselves and not waiting for either the state or the federal government to come and rescue us. Thank you for putting this presentation together. There's a motion on the floor. There's a second to the motion. Is there any other discussion that you'd like to add?
One little quick thing, just the fact of the matter is that these guys came in projecting about a $30 million deficit and not addressing some of those pay disparity needs. They've addressed them and we're down to 13 million. That's a pretty great job by this team. So I just want to recognize that. Let's go ahead and vote.
Alrighty, Councilmember Dahl. Nothing? Okay. So all those in favor of the motion, please indicate by saying aye.
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 Any against? Motion carries. Thank you so much. Thank you, Angel, Anna. Item 4, time has been set aside to discuss recommendations for the next RTA board meeting. Mr. Manager.
Honorable Mayor and members of the council, joining us at the table will be Director of Transportation and Mobility, Sam Credio, who got to spend some quality time with you yesterday.
Almost 5 hours to be specific.
Almost 5 hours. That's hazard pay for Sam. And with that, I think between the two of you, you've got actually the best update that you could give to your colleagues. Thank you.
Thank you, Mr. Manager, and good afternoon, Madam Mayor, members of the council. I will do my best to condense about 5 hours into a 3-minute verbal update and be available to answer any questions. There was actually 2 meetings held yesterday. First, the PAG Regional Council meeting, and then followed by the RTA Board meeting. The only thing I want to note on the PAG Regional Council meeting is I want to congratulate Mayor Romero on being elected the PAG Chair. It is the first time Tucson has held a leadership position at either PAG or RTA in over 12 years. So. Beyond that, there was other things that were discussed, but not so much pertinent to RTA. So I do want to spend the most of the time talking about the RTA board meeting, which followed right after that meeting. There were 2 main items on the agenda to discuss, and that is costs to complete the current RTA plan and followed by the RTA Next Plan Development Update. The cost to complete item is a standing agenda item for the RTA board, and they have been talking about this for some time. RTA staff first began with an update on all the remaining RTA projects. I do want to note that the City of Tucson has 12 remaining projects. All of those projects are active in various stages, whether it be planning, design, or construction. The RTA staff then provided an overview of the remaining funds to complete the RTA plan. According to RTA staff, there is currently a funding shortfall of $143 million after all available funding resources are accounted for.
Wait, Sam, does that include the ones we've already dropped?
That is correct. That includes, that does not include the deferred projects.
So in other words, the deferred projects notwithstanding, we're still 143 short.
That's correct.
That's just great.
The following that or as part of that presentation, the RTA laid out 3 solutions to resolve this funding shortfall. The first is local jurisdictions provide additional funding to close the shortfall. The second is reduce project expenditures. That item was rather vague, and we didn't quite understand what that meant other than scope reduction, which has been received with some pushback from RTA staff. Which brings me to the third item, defer projects with significant scope changes to RTA Next. To your point, Councilmember Cunningham, there are 4 projects that have already been shifted to RTA Next. That is the City of Tucson's Houghton Road, Broadway to Tanque Verde, and 22nd Street, Keno to I-10. For Marana, that is Silver Bell Road, Camino del Cerro to Ina, and for Pima County, that is First Avenue, Orange Grove to Ina. The value of these deferred projects is $239 million in RTA Next.
So they finished $375 million in the whole total so far, and they think they're going to be able to go, they have the trust of the voters to go back out and get it again? Isn't insanity one of those things where you keep doing the same thing and you don't expect a different result?
And so after that presentation, discussion did occur by the RTA board. There was no action taken, and again, this is an ongoing discussion with the RTA board. The follow-up item and last item of the agenda was RTA Next Plan Development Update. The staff provided an update on the outreach that has occurred for the RTA Next Plan. That was the most significant update. And I'll just give you a few highlights. Between November and January, there were 15 open houses that were held, including 1 virtual event. There was a survey that was conducted region-wide. Of the 660,000 registered voters in Pima County, 2,213 folks responded to that survey. Just a couple notes. I won't get into all the details of the survey metrics, but there were 2 that stuck out to us. One is that of the 2,213 respondents, only 14.6% self-identified as Hispanic or Latino. That is far short than the 42% in Pima County, based on Pima County demographics. And then also, we noticed that people making less than $50,000 annually were underrepresented in the results as compared to Pima County demographics. Now, one thing to note is that the RTA did hire a consultant, a Gorley Group, to engage Pima County's traditionally hard-to-reach populations. And according to the RTA, this was done by the following methods: organizational outreach to nonprofits or groups that work with the traditionally hard-to-reach population of our community. They held open houses in strategic locations, pop-up events, intercept surveys on transit routes, posters in areas of service, digital advertising, and social media. And lastly, the RTA did receive 74 email responses. These responses came in through a comment link, which is actually still active on the RTA Next website, even though the survey has closed. And included in the packet was the responses to these 74 emails. Lastly, there was a short discussion that occurred on the timing of finalizing the RTA plan. In order for Pima County to call a November 2025 election for RTA Next, the RTA board will need to finalize the plan by May 2025. And as part of the RTA agenda, there was conversation about having additional meetings between now and then. With that, Mayor, that concludes my update. And if there's anything you'd like to add, please feel free. Thank you.
No, I just want to congratulate the other board leadership for PAG, which the vice chair, I believe, was Marana, Mayor John Post, And the treasurer is Mayor Tom Murphy. At the RTA side, Oro Valley Mayor Joe Winfield will serve as chair. Sahuarita Mayor Tom Murphy will serve as vice chair, and Supervisor Adelita Grijalva will serve as second chair. And so that's the leadership. We had, as you heard, 5 hours worth of discussion, and there was pretty much no answers in terms of how the 12 City of Tucson projects will be delivered to Tucsonans. And so that's something that we need to work on. And in terms of thinking through at the City of Tucson side, how do we prepare with ideas as to how to resolve those issues? $148 million, I believe we were short to deliver the projects that were promised to the voters in 2006. And that's not counting the 4 projects that were forwarded to the RTA next. So we've got to really figure out as an RTA board and as a mayor and council what we'd like to see happen as we move forward for those projects and how we're going to deliver them to the community. What I did advocate for at the RTA board was that the board make the decisions in terms of how we pay for the projects that are pending, and that should include PAG funds that come to the region from the federal and the state government. And then it should also include some scope changes to the projects that we have in front of us. So I think that possibly, Mr. Manager, that's something that we should start. We should start putting our own ideas together and presenting them to mayor and council as to how we resolve that, because I don't feel as though there are any answers coming from the staff at the RTA. So I think it's better if we put forward a plan, a concept as to how we're going to move forward, get the funds, and deliver those projects to the voters. Vice Mayor.
Well, first of all, I also wanted to congratulate you, Mayor, for representing us, and I think it'll, be very beneficial in helping guide the conversations of everything you've been, speaking up and out about during this whole process. I am curious if now with the new leadership, if there's opportunity to maybe change the schedule of when we go to the voters. Because I think we need to answer that question of what do we do with the projects that haven't been funded if we are to go to the voters and have their trust that we can deliver. So was that part of the conversation? Are you thinking
There
that?
were mentions of it, actually. Mayor Murphy from Sahuarita and Ted Maxwell, that sits on the board as ADOT representative, mentioned that it might not work out because if we don't figure out how we pay for RTA 1 projects, and if there would be a possibility of forwarding some of those projects to the RTA next, then we would need to figure out what projects from the RTA next are removed from the list so that we can fulfill the projects from RTA 1. So I don't feel we are anywhere close to when Pima County needs to call an election, which is, I think, in April, for November. So I think there's some realization from RTA board members that maybe November's can't happen without finding these answers.
Does that mean that the current tax would sunset and then we'd have to come back to the voters at a later time, or how much time are we talking about?
I think
before
that
the
there's
sunset?
still an opportunity to do it in the spring of 2006, I believe. Correct me if I'm wrong. Of 26. I'm sorry, 2026. June is when the tax goes up until.
Yes, Mayor, that's correct. The RTA sunsets on June 30th, 2026.
So we would have the spring of 2026 to.
I would love to time travel to 2006 and
Yes.
something different.
Yes. All right, any other questions or comments on this item? Alrighty. This was yes, Mr. Tamir.
Sorry, thank you, Mayor. When we say spring, I think we need to be a little more precise.
Okay.
Because of the new state laws about when an RTA tax would go into effect, which is the nearest April 1st, if I have that correct. A March ballot could theoretically be enacted by April 1st. But if it was a May ballot, I think you may face having to wait till the following April 1st. I'm not certain on that, but November is already getting a little late.
Good job going with May, and then you may.
So that was informational purposes, always open for your input on RTA and RTA Next. Please feel free to give me your feedback or advice, and the same thing with our city manager and our Department of Transportation and Mobility Director, Sam Credu. Thank you, Sam, for the input. Alrighty, we're moving on to item 5. Let's see, item 5, time has been set aside for mayor and council to receive an update on state and national and regional committees, executive orders, and direction to any associated litigation. I just wanted to say, I think it's diminishing when you say that we're living in challenging times. It's an understatement. I think that we continue to be challenged with executive orders, judicial actions, funding freezes, and more. We are seeing mass deportations and mass firings across the government, the federal government areas that are continuing to have more and more impacts for everyday people. I have learned that at Housing Community Development, they are suffering delays because of the firings that have happened at Housing and Urban Development in the federal government. Just last night, we learned that tariffs with Mexico and Canada were put in place. So we will see the effects of those tariffs with our residents, and it's going to affect including even housing and how much housing costs, because lumber is being attached with tariffs at the federal level. And at the end of the day, tariffs are paid by people here in our country. And so it is very concerning, chaotic, and scary times that we're living in. And there's a lot of questions up in the air as to how all of these changes are going to affect Tucsonans and Arizonans. So with that, I don't know if our city attorney had an update, or if we wanted to go with Andres to talk to us about federal state. Mike?
Mayor, members of the council, I was just going to address one of the questions that you are all getting all the time, and we get as well, which is, well, how much federal funding is at risk for the city of Tucson? And from my perspective, if the money is not in our accounts and spent, then it's at risk. And as the city manager said at the last meeting, the amount of awarded federal funding that we have yet to expend is approximately $285 million. I think it's a fair measure to say that that money is currently at risk. And that doesn't even capture the money that would be at issue going forward, that the city would typically get through formula funding or in future competitive grant proposals, which is a much larger number. The vast bulk of that federal funding, that $285 million plus, that we receive is for public safety, police and fire, transportation projects, as well as housing. Those are the areas that are most at risk for us and for most cities. that are dealing with these cuts or freezes or pauses or whatever they're being called. A few examples just to give some perspective. You got your Choice Neighborhood Implementation Grant. As you all know, that's a $50 million grant for specific affordable housing projects, the largest of which, of course, is the Tucson House Rehabilitation Project. In reliance on that grant award and the agreements that were executed under it, there's been some extraordinary work that's been done to move those projects forward, and now everything is uncertain. Continuum of care funding to address homelessness and provide permanent supportive housing. There's funding already awarded for this fiscal year, the current fiscal year, that approaches $15 million. And it's not just funding to the city, it's with partner agencies, TPCH primary among them. Again, that has not moved forward to a point where we've actually received the grant agreement to memorialize the award, which was already approved. So it's at risk. Transportation funding, 22nd Street Bridge Replacement Project. I think you all know that's a $25 million award under the Bipartisan Infrastructure Act. It's core infrastructure. It's a replacement of a bridge built in 1966 that commercial trucks, buses, emergency vehicles can't go over because of the weight restrictions. It needs to be replaced. That funding right now seems to be on hold or pause or delay or whatever the term you want to use. We continue to monitor the court rulings. We are literally in meetings, participating in meetings and phone calls every day with other jurisdictions and their attorneys and their representatives and their officials to try and keep our ear to the ground about what's next. And we'll take what actions are appropriate to protect our interests.
Thank you, Mike. Andres? Go ahead.
Thank you, Honorable Mayor and members of the council. Mr. Rankin has been a stellar partner in tracking all of our federal updates. We do it at midnight sometimes online, and it just is really a plethora of information coming our way. And so bear with me as I try to give you an update from Washington. The U.S. House narrowly passed a budget resolution with all Democrats and even one Republican voting against it, highlighting the controversy with the budget bills going forward in Congress. Congressional Republicans aim to use the budget reconciliation process to pass it with a simple majority, bypassing the Senate filibuster. The Senate passed a skinny budget resolution increasing defense, border, and energy spending while addressing tax cuts separately, and the House and Senate must now reconcile those two versions, though President Trump has said he prefers a single bill as passed by the House. The House budget outlines $4.5 trillion in new spending, prioritizing defense, immigration enforcement, and tax cuts benefiting corporations and billionaires. Meanwhile, it calls for $2 trillion in cuts to key federal programs, including Medicaid, SNAP, and education, which of course are critical lifelines for Tucsonans. Specific directives from this committee include $880 billion in cuts over a decade from the House Energy and Commerce Committee, that's where Medicaid lives, $230 billion in cuts from the House Agriculture Committee, impacting SNAP, the nation's largest anti-hunger program. So we are continuing to monitor what this will mean for Tucsonans, and of course are closely tracking all of the financial agreements that are currently pending or still need to have some movement moving forward. So that's a quick update from DC. I want to give you some updates on what's happening at our state capitol. This is day 51 of session. Last week was a marathon voting week with some efforts still underway to get some of those bills across the chambers. We are actively tracking legislation on your behalf with 9 new bills added to our tracker as shared with your offices earlier today. I want to update you on Senate Bill 1304. It's known as the Ag to Urban Bill. This bill is water related. It will allow cities in active management areas like Tucson to be designated as having an assured water supply if they meet specific criteria. We're recommending an opposed position for the time being given the following reasons. Water resource concerns. This bill could have unintended consequences on our long-term water sustainability. Lack of data. There's no comprehensive analysis that has been done on the impact of this bill, particularly in the Tucson area. And The Arizona Department of Water Resources is negotiating with the bill sponsor and actually recommends excluding Tucson from the bill as well. And so our ask today is to continue to monitor the bill, but also to try to not be a part of the ag to urban conversation that is primarily Pinell and Phoenix active management areas. Want to briefly update you on housing and zoning legislation. Negotiations continue between cities, legislators, and the governor's office on proposed housing and zoning laws. As you know, mayor and council have formally opposed what's known as the Starter Home Act due to the broad preemption of local authority. We are working diligently to proactively brief all of our delegation on Tucson's housing affordability strategy, as well as highlighting the direction you've given to staff on the community corridors tool, which we see as a locally driven solution to increase our housing stock and without state preemption, by the way. This approach has been well received, and we continue to proactively engage our success on these efforts. Want to remind everybody that as the state legislature considers all of its bills, the state budget, of course, is still in limbo. There is no current deficit as a result of the hard cuts that were made last year. We are estimating roughly around $200 million in available one-time spending, with border security and tax refunds being a key priority of the majority party. Last but not least, just want to keep you posted that in your inbox you do have a summary of the 34 ballot referrals that are being considered for the 2026 ballot. Won't go through all of them right now, and not all of them, of course, will make it past both the House and the Senate. But if they do pass both chambers, those bypass the governor and go straight to the ballot in 2026. So with that, I am available for any questions on state and federal matters. Thank you.
Councilmember Ulick.
Thank you. Really briefly, and colleagues, I apologize for not flagging this sooner. Andres and I have connected regarding Senate Bill 1257. It relates to essentially court-ordered treatment for folks with addiction and substance use. It allows for a 5-day stabilization period and is supported by our colleagues on the Pima County Board of Supervisors, as well as Dr. Balfour, who oversees the Crisis Response Center here. I'd like to add it to our tracker with a note of support, recognizing that it's funded primarily through Medicaid dollars, and we need to track whether it is then an unfunded mandate in any form. But I think there's enough substance that addresses some of the fentanyl concerns, especially that we've discussed, to add it to the tracker. So I'd move that we add it to the tracker with a note of support.
Second.
There's a motion and a second. Any further discussion on this item? Hearing none, all those in favor indicate by saying aye.
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 Any against? Motion carries. Thank you so much for bringing that to us, Councilmember Ulick. It's, I feel much better that you feel comfortable and Dr. Balfour feel comfortable with this bill. It's a new territory that we're walking into, and so I hope that there is attached funding to this bill, and that it does work well with other behavioral and mental health services that could possibly be attached to them. Anything else that
Hey,
you'd
get
like
out
to?
of here.
Councilmember Fimbres?
Sorry.
Oh, okay. All righty. With not anymore, I think that you have clear direction in terms of where we stand on certain issues and certain bills, correct?
Yes, that is correct, Honorable Mayor and members of the council. Thank you.
All righty. Well, I just wanted to add, just a few examples of what's happening in the federal government that will affect Tucsonans today. In response to the tariffs that Trump administration put into place, Mexico's President Claudia Sheinbaum is expected to impose retaliatory tariffs on the U.S. this weekend. Canada's Prime Minister Trudeau has started retaliatory tariffs that began on Tuesday, which is today. For us here in Tucson, the Medicaid and SNAP programs cuts will disproportionately hurt low-income families, seniors, and individuals with disabilities. It will slash critical safety net programs for working families. Nearly 80 million low-income children, pregnant women, adults, seniors, and people living with disabilities across the nation rely on Medicaid. As of October 2024, close to 2 million Arizonans were enrolled in Medicaid and CHIP program. If these cuts move forward, states like Arizona will be forced to fill the gap, leading to a loss of coverage, reduced benefits, and stricter eligibility requirements for vulnerable communities. SNAP is a lifeline for hundreds of thousands of Arizonans, 923,400 to be exact. That's 12% of Arizona's population. More than 68% of Arizona SNAP participants are families with children, almost 29% of families with older adult or disabled members, and more than 40% are working families. SNAP benefit families and stimulates local economies. So the U.S. Department of Agriculture estimates that every $1 invested in SNAP benefits generate about $1.50 in economic activity. So many Arizona families are already struggling with food insecurity and poverty. These potential cuts from the federal government would push Arizona's hardworking families over the line. I'm outraged at the proposed cuts, as I know my colleagues on the council are as well, and I'm outraged that the congressman in District 6, Juan Ciscomani, voted for those cuts and voted for trillions of dollars of tax cuts to the wealthiest people in this country, as well as corporations. We're not sitting idly by. We're joining in coalition with cities across our country to make our voices heard on the impact of these cuts and what that means to everyday Arizonans and everyday Tucsonans. Our Southern Arizona congressional delegation, Senators Kelly and Senator Gallego, Representative Grijalva and Representative Ciscomani, understand, or should understand, the importance of Medicaid and SNAP. So I asked Tucsonans to join me in demanding that our congressional representatives stand up for all of us here in Arizona and make our voices heard by their vote in Washington, D.C. We can't let up. It is a vicious game of whack-a-mole at this time. As one potential area of cuts is addressed, another one will rise. The funding for education, housing, transportation, healthcare, and other essential services are in jeopardy and on the chopping block through this budget bill. We need to be clear with our community so that they can understand how these services provide for Tucsonans and Arizonans. So I just wanted to add that because, as I said earlier, there's a lot of concern about what this budget bill will mean to our community. I don't know, Andres, if you need any additional direction from Mayor and Council on this item.
No, thank you, Mayor.
Thank you so much. Thank you, Mr. Tamir, and thank you, Mr. Rankin, for your update. We move on to item 6. Does anyone have any items to remove from the consent agenda today? Hearing none, we move on to item 7. Does anyone have any items for future agendas? Alrighty, hearing none, study session is adjourned.
I'm aware. I had the public research report audit we did last year. I want to add it on again. For me, update on it. Thank you, Madam Mayor.
Mr. Rankin?
So we'll add it when we get the memo from the council office to add that item.
Oh, okay. We will make sure that you bring that item to Agenda Committee, Councilmember Fuentes. Alrighty, hearing none, no others, then study session is adjourned. I am going to give us a 20-minute break, so 5:40, to be able to be back to start regular session. Thank you all. I'm doing this for you guys. This meeting will be called to order. For the record, Councilmember Fimbres will be participating electronically through Microsoft Teams. Council will stand in session. Let's go to roll call.
Mixulik? Mrs. Lee?
Here.
Mr. Cunningham?
Here.
Mr. Dahl?
Here.
Mr. Fimbres? Mr. Fimbres? Vice Mayor Santa Cruz?
Here.
Mayor Romero?
Here. Should we ask Mr. Fimbres again?
Mr. Fimbres?
Alrighty, he's there somewhere, but.
I saw Mary on there, and he's probably having some technical issues.
Alrighty, so before we go to item 2, the city attorney will go over, this is not this space, right? Yeah. Before we go, to item 2, the city attorney will go over the rules of decorum for mayor and council meetings. Mr. Attorney.
Thank you, Mayor. Arizona's open meeting laws provide that members of the public may attend and listen to the proceedings during tonight's public meeting of the Mayor and Council. Arizona law also allows the Mayor and Council to enforce rules and procedures for public attendance to ensure orderly behavior and to prevent any unnecessary interference with the public meeting. So here are the rules that apply. The rules require decorum and orderly conduct by members of the audience. No person attending the meeting shall engage in conduct that disrupts or otherwise impedes the orderly conduct of the meeting, including any statements or conduct that interrupts persons who might be addressing the Mayor and Council or that disrupts the discussions of the Mayor and Council themselves. The mayor has the authority to ensure compliance with the rules of orderly conduct. If disorderly or disruptive conduct continues after a warning, and this is that first warning, the mayor may direct the removal of persons from the chambers or recess the meeting itself if necessary. If disruptive behavior makes it necessary to clear the chambers, the persons who disrupted the meeting will not be allowed to return to the chambers for the remainder of the meeting. As a final note, please be aware that interfering with or preventing a lawful public meeting from being carried out in an orderly manner not only violates these rules of participation, but also violates Title 13 of the Arizona Revised Statutes.
Thank you, Mr. Attorney. Item 2.
Invocation, Pledge of Allegiance, and appointments to boards, committees, and commissions.
The invocation will be given by Pastor Ashley Evans of the 22nd Street Baptist Church. After the invocation, I ask that you remain standing for the Pledge of Allegiance.
Thank you, Mayor and City Council. Psalm 118 says, "Give thanks to the Lord, for he is good. His faithful love endures forever." If you're so inclined, I invite the members of this meeting to join me in prayer. Father, we give you thanks. We give you thanks for this great city. Lord, I thank you for the beauty of the mountains that surround us. Within minutes, we can be up in nature enjoying your beautiful creation. God, I give you thanks that we don't have the traffic that the city up north has. God, I give you thanks that we have the best Mexican food in all the country. And God, I give you thanks that even though no city is perfect, we get to come to meetings like this, address our concerns, and go away from here committed to make this city even better than it was before. Lord, be with our city council and leaders, be with each person here, and Lord, help us to do all we can to glorify you. In Christ's name I pray, amen.
To
Your Honor, Pastor Ashley is from Terra del Sol Church in Ward 2.
Thank you so much, Pastor, for gracing us with your presence. We really appreciate it. And also proclaiming that we have the best Mexican food. I'm just saying. Alrighty, item 2C are presentations. I would like to proclaim March 4th, 2025 to be Procurement Day and Procurement Professionals Day. And I know that we have a bunch of wonderful people that will be with us. Nathan Dow, the Procurement Administrator, Norma Camacho, Principal Contract Officer, Nora Corral, Senior Contract Officer, Salvador Servin, Contract Officer, Leticia Riesgo, Senior Contract Officer, Sonia Lasso, Senior Contract Officer, Tracy Garcia, Procurement Manager, Rolf Averill, Contract Officer, Christopher Jeffroy, Contract Officer, Garrett Gillespie, Contract Officer, Chad Fields, Labor Compliance Officer 1, Maria Hartke, Contract Officer, and Casey Adams, Principal Contract Officer. And then I have Lloyd Windle and Vanessa Stevens. Meet me up there and I'll be right there with you. And if anyone wants to join me from the council, please feel. Hello, everyone. Don't be shy. Don't be shy. We're celebrating you all and what you do in your professions. And so we highly appreciate the work that you do. Procurement officers really value add to the work that we offer, the services that we provide to our community. You do everything from procuring our parks, and different capital projects in our parks. You procure the widgets that we buy and make sure that we get the best deal and the best product. And everything that you do really makes the work and the services that we provide the residents of Tucson much better. So what I'll do is I'll give you all this, if you'd like to hold it, and I will read. I have big letters, so you can. So on behalf of the City of Tucson and the Office of the Mayor, I would like to proclaim March 2025 as Procurement Month in the City of Tucson and March 12th, 2025 to be Procurement Professionals Day. So with that, whereas the public procurement profession plays a significant role in the efficiency and effectiveness of both government and business. And whereas procurement professionals add value to the organization by performing such functions as executing, implementing, and administering contracts for goods, services, and construction, developing strategic procurement strategies, and cultivating working relationships with suppliers and other departments within the organization. And whereas the procurement professionals in the City of Tucson and other public organizations are uniquely positioned to build public trust in our government institutions by diligently ensuring fair and open bidding opportunities to the vending community and providing transparency in government contracting. And whereas the procurement professionals in the City of Tucson are instrumental in executing the Mayor and Council's vision for contract-related programs such as the Small Business Enterprise Program, Living Wage Program, and the Prevailing Wage Program. And whereas the procurement professionals in the City of Tucson recognize, support, and practice the public procurement values and guiding principles of accountability, ethics, impartiality, professionalism, service, and transparency established by the NGP, the Institute for Public Procurement, as fundamental tenets of the public procurement profession. And whereas NIGP has proclaimed the month of March as Procurement Month to further expand the awareness of procurement professionals' role to government officials, the general public, business, and corporate leaders. Now, therefore, I, Regina Romero, Mayor of the City of Tucson, Arizona, do hereby proclaim the month of March 2025 as Procurement Month and March 12th, 2025 as Procurement Professionals Day in the City of Tucson, and urge all of our residents to join the City of Tucson in recognizing the role of the purchasing and materials management profession within business, industry, and government. In witness whereof, I have hereunto set my hand and caused the seal of the City of Tucson, Arizona, to be affixed this 4th day of March, 2025. Congratulations, and thank you for all you do. Did you want to say anything? Anyone?
All right. Well, Mayor, thank you very much for this proclamation. We really appreciate it. And I'm so happy that we have about half of your procurement team here. And I just want to say that, the main piece of enabling legislation that gives us the authority to act and sets the parameters for how we act is the collection of city ordinances adopted by mayor and council that we refer to as the Tucson Procurement Code. So all of these folks know within their first week in their onboarding, I have them read the entire procurement code. I walk them through it line by line. Over the course of about 8 hours, they love every minute of it. But they're the subject matter experts in that, and they really carry out the mayor and council's vision for that. So just if I can mention some of the folks that we have here, we have folks from our contracting team. We have a team of 20 folks that procure about $400 million worth of contracts each year and negotiate those with the assistance of Mike Rankin's fantastic attorneys. And we have folks from our Small Business Enterprise Program, a program created by the Mayor and Council's ordinance, who set subcontracting goals for the primes to subcontract work to different subs. And we have folks from our Labor Compliance Program who make sure that employees of primes and subcontractors receive the prevailing wages that they are owed. So that's just a few of the folks here that work hard day in and day out to carry out the mayor and council's vision that you've set for us in the Tucson Procurement Code. So we really thank you.
Thank you so much.
Thank you, council member, too.
And thank you, and we really appreciate all your work. We really do. Thank you.
Thank
And
you.
if you want to turn around, just turn around. Stand where you are and turn around, and we'll take a picture during this vice mayor. And if you want to open the yeah. Thank you. Thank you so much.
Thank you very much.
All righty, we move on to item 2D.
Appointments to boards, committees, and commissions.
City Manager's Communication Number 65, dated March 4th, is received into and made part of the record. Are there any personal appointments to be made at this time? Hearing none, we move on to item 3.
Mayor and council report summary of current events.
City Manager's Communication Number 61, dated March 4th, is received into and made part of the record. This time has been scheduled to allow members of the mayor and council to report on current events. These are to be current events of activities within the community, not position statements on policy issues. Does any council member have anything to report at this time?
Thank you, Madam
Councilmember
Mayor.
Fibres, and then we'll start over here at the dais.
Thank you, Madam Mayor. March is Women's History Month. I want to encourage everyone to reflect on the contributions that women have made in our great city and country and county. Here at home, we are lucky to have the leadership of Mayor Regina Romero, the first woman and the first Latino mayor of Tucson. I want to commend Vice Mayor Lane Santa Cruz, council members Nikki Lee and Carolina for their leadership and commitment to our city. Thank you all for doing this, Madam Mayor. I want to congratulate my Chief of Staff, Pito Robles, and my Mayor Kuchar Letty and Cindy Gonzalez. We want to thank our city manager, Tim Tamira, and our city UFO, and Rosemary, who for putting on yesterday's budget town hall. It was very well attended. I hear our employees are learning and providing input on the budget process. I heard very good things about yesterday's event, and I want to commend both Tim and Annie for their efforts. I want to congratulate the Sunnyside High School girls wrestling team, coaching on winning their first state championship. Ada Armstrong, Ali Ibarra, Isla Villalobos, Solila Ponce, Jaylene Wyatt, Jaylene Alfaro, Brianda Marquez, Alex Robles, Ali Robles, Alexandra Maroki, Mia Vasquez, Bianca Cobo, Liana Castaneda, Isabel Vasquez, Miabla Martinez, Sunny Robles, Dina Puentes, and Sarah Moreno, coaches Joel Zapata, Ray Martinez, Ricky Villegas, James Armstrong. I want to take pride in their hard work and dedication that led them to achieve this significant victories, bringing into our city, go back Blue Devils, which is more happy to be Ward 5. Thank you, Member. That's all I got.
Thank you, council member. We're gonna start with Ward 6 and then go down the line. Councilmember Luke, Councilwoman Lee, Councilmember Dahl. Did you want to add a summary of current events? Oh, we did. Everybody skipped up until you.
Sorry, I'll fill in the space. I have 5 announcements. Details on these are in the Ward 3 newsletter, which you can read online or subscribe to. Parks and Recreation is doing community conversations about food distribution at city parks. There's a virtual one tomorrow evening and in person at the Donna Liggins Center this Saturday. At my ward office, United Way Vita is providing tax preparation help for individuals and families who earn up to $79,000 annually. Saturday mornings in our community room. The Rito Bend Neighborhood Association is having a family-friendly spring arts and music festival Saturday, March 8th at Valley of the Moon. On Saturday, March 15th, the Amphi neighborhood is having a resource fair. Finally, I want to give a hearty congratulations to our colleague, Vice Mayor Santa Cruz, for being recognized by the Southern Arizona AIDS Foundation at their annual Out Brunch this past Saturday. Vice Mayor Santa Cruz was honored by SAAF as the 2025 Richard Elias Public Servant Awardee in honor of her community leadership and advocacy on behalf of Ward 1 and indeed the entire city of Tucson. As someone who called Supervisor Elias a friend and recognized him as a stellar public servant, I know how proud he would be of this recognition. Congratulations, Vice Mayor.
Councilmember Cunningham?
It's that time of year. First of all, this week, most of the little leagues in town are starting their opening day. Rincon, Cactus Empire, Randolph, Western, they're all starting this week. So good luck to all the teams that are participating. That same goes for slow pitch softball, Saguaro, Randolph, Western. They're all starting. So really exciting that we've hit that season. The other piece is I really want to take some license and congratulate 3 Ward 2 schools. Saguaro High School was ranked #1 in the state all year. They lost in the playoffs, but they had a great season. Palo Verde High School made it all the way to the state final, and they did a great job. And I just can't tell you how proud of the Palo Verde Titans we are on the east side. Not only did that happen, but Palo Verde High School Student Council came together with Wheeler Elementary Wildcats about a week ago at Terra del Sol Park. And the big thing is we had a very random act of violence in that park about 6 months ago. And as a result, kids were kind of nervous about going to the park. But thanks to Jen Warnstadt, my former colleague at Apollo Middle School, who grew up in that neighborhood, we actually repainted all the tables and had the kids from Wheeler put their handprints on them. And during the event, we also had members of Palo Verde Titans Student Council attend and kind of help the kids with the painting part. So it was a great event. So I'm really proud of that school. And finally, that brings me to the Gregory School, which happens to also be in Ward 2. Congratulations to their team who won their second state championship in a row in basketball. I will like to mention that all 3 of those schools had players that used to participate in the Ward 2 program, Wednesday Hoops, which is a free program for basketball for middle school kids after school that we hold during the year. And so I don't want to say it's because of Wednesday Hoops they did it, but I think it's still good to point out that they all participated. I also wanted to thank all the people who showed out for the cleanup last week on the east side. Many more to come, and that's the end of my report.
Vice Mayor?
Yeah, thank you, Mayor, and thank you, Councilmember Dahl, for your kind words and for the recognition. I want to just, remind the public that at a November 7, 2024 study session, our Mayor and Council directed our Parks and Rec staff to host community dialogues exploring ways that the city can support local food distribution efforts by faith-based organizations and mutual aid groups to community members experiencing food insecurity and while also addressing neighborhood and food safety concerns. So the first conversation that'll be facilitated by the Center for Community Mediation will be virtual this Wednesday, March 5th from 5:30 to 8 p.m. over Zoom. And then in person Saturday, March 8th at 9 a.m. to 11:30 at the Donna Liggins Center. And I believe Parks has a registration link for that. Then on Saturday, March 8th, we have 2 events coming up back to back at from Rose Neighborhood. We're gonna have Tucson Clean and Beautiful and Barrio Restoration do a cleanup around the neighborhood. So the public is invited to join. It's at 8 a.m. to 11 a.m. And the meetup location is at Rodeo Park Wash behind CE Rose Elementary School. And then on Saturday, March 15th from 9 a.m. to 11 a.m., coming back together to join Tucson Clean and Beautiful for a tree planting in the neighborhood. Join us in planting trees to grow our tree canopy, strengthen our communities, and support Mayor Romero's Tucson Million Trees initiative. The location for that will be at the CE Rose Neighborhood Park at 710 West Michigan Street. And then this coming Sunday, March 9th from 9 to 11, join us for our West Side Ride, BCC Burros. The morning bike ride takes place on the second Sunday of each month. Starting at the Ward 1 office, we ride through the West Side, downtown, and enjoy a fun community center cycling experience. We meet at the Ward 1 office at 940 West Alameda Street. Thank you.
Thank you, Vice Mayor. I too want to add how proud I am of you being recognized with the Southern Arizona Aid Foundations, especially receiving the Richard Elias Public Servant Award. As you and I well know, and so many other in our community, Richard Elias was an authentic and wonderful person that carried truth and spoke truth to power, and had so much lessons for all of us. And so a mentor to you and I and so many others, it is beautiful to see you receiving that award because you are carrying his legacy in your service to our community. So thank you. I too feel very proud of you receiving that award, not just for yourself, but for so many of us at that stage. So also March is Women's History Month, and March 8th is International Women's Day. This month for me, it's a time to think about the women in my life that have made my leadership and work as mayor possible. I can't start by talking about women and women mentors without talking about my mother and my sisters. They're super strong women and aunts that really taught me how to take a stand. And even if sometimes you're afraid as a woman to say something, to be able to say the truth that we carry as women. Dolores Huerta and so many other women here in this community have really shaped the way that I see the world, including Mona Grijalva, Isabel Garcia, so many other women, including Alba Torres, Donna Liggins, like so many women that have made a difference in the life of Tucsonans and have served our community. It really is beautiful to be able to see the generations of women, including these women up here that I serve with, Councilman Lee, Vice Mayor Santa Cruz, Councilmember Ulick, who took me by the hand when I first came to work for the city of Tucson. Thank you for everything that you do to be good servants. And so let's take a moment all of this month to really celebrate the women that have made such a difference, not just in our country in Arizona, but here in Tucson. I also want to take a moment to acknowledge the women in leadership across all departments in the city of Tucson. And if you could see up here in the dais where all of our administrators sit, 4 out of 6 are women. And so I just want to thank Mr. Tamur, our city manager, for really bringing to your team such incredible leadership. Thank you all for your dedicated service and leadership to our community. We really appreciate it. Tomorrow, on another note, tomorrow, March 5th, is the last day to mail in your ballot for the special election on Proposition 414. Make sure your voice is heard and don't wait until March 6th. March 5th, which is tomorrow, is the last day to mail your ballot. If you don't mail it in tomorrow, you can always walk it in on Election Day to the more than 6 voting centers that we have in Tucson and drop off your ballot. So with that, I have no other announcements, but we will be asking our city manager for his announcement. So item 4.
City Manager's Report, Summary of Current Events.
City Manager's Communication Number 62, dated March 4th, is received into and made part of the record. This time has been scheduled to allow the City Manager to report on current events. Mr. Manager.
Thank you, Mayor, very much. For tonight, I just have one announcement. It's a little bit different, and I don't want to steal Councilmember Dahl's prop comic shtick here, but we got invited to a wedding. And by we, I mean the entire city of Tucson. I'm not going to suggest we all show up. But we received this kind note from a couple that they actually live in San Diego. And they wrote a note about how they met in Tucson at the University of Arizona. They fell in love with each other and with Tucson. And I'm just going to read a couple snippets from it. They talk about their journey, and they list Gates Pass, various U of A buildings, restaurants, bars, the movies. Their 1-month anniversary was at the Desert Museum, and they have a Lovelock downtown. They come back to Tucson, it brings back memories, and they've decided to actually have their wedding here in Tucson. And so they wanted Tucson to be where they got married as well, so they say, thank you for being the most quirky, interesting, culinarily advanced, weird, cactus-heavy little town that still amazes us Idahoan. So it's from Melissa, Lynn, and John, and this is just the first time I've seen something like that, so I wanted to share that with everybody. Thank you, Mayor.
That is so cool. Just give me the time and location and let us know if they have an open bar or not. Cash bar, okay. Item 5.
Liquor license applications.
City Manager's Communication Number 66, dated March 4th, is received into and made part of the record. Ms. Clerk, please read the liquor license agenda.
Your Honor, on this evening's agenda, we have one application for person location transfer and 5 special event applications. All applications are in compliance with city requirements, so an appropriate motion would be to forward items 5B1 and 5C1 through 5C5 to the State Liquor Board with a recommendation of approval.
So moved, Your Honor.
Second.
There's a motion and a second. Any further discussion on this? Hearing none, all those in favor of the motion signify by saying aye. Aye. Any against? Motion carries. Item 6.
Call to the audience.
Ms. Clerk, please read the announcements.
At this time, the public is allowed to address the mayor and council on any issue except for items scheduled for a public hearing at this meeting. Call to the audience will last approximately 30 minutes, and speakers are limited to 3-minute presentations. The green light will turn on when you begin speaking. It will turn yellow and beep when you have 30 seconds left to speak. When your 3 minutes are up, the light turns red and the timer will beep again. If that happens, please immediately conclude your remarks. Thank you.
All righty. Is that thing working? Okay, so our first speaker is Dominic Meister. Can you please use the tall mic? There you go. Thank you.
City Council and Mayor, my name is Dominic Meister and I live in Ward 3 in Pima County. I represent no group. I'm here to speak on an issue of common sense. I'm speaking on the recurring misuse of taxpayer dollars, wasteful spending that will only worsen under Prop 414. Sources report that nearly $1 million was spent promoting this one-sided proposition which pretends to benefit public safety. But the reality is that the minimum that taxpayers are supposed to be provided by you as our leaders will not be accomplished now. It will only have a chance when we fund your self-serving political ideologies using Prop 414. City Manager Tomir called the city's stance on Prop 414 neutral, yet SWAT vehicles and police on overtime were used to promote it. The voter info pamphlet buried the one and only opposition under pages of pro 414 arguments. Neutral? Hardly. At Regina Romero's annual address, I had a talk with the East Side Police Chief who said they were, and I quote, clawing, biting, and scratching for basic equipment like bullets and vests. This is a clear push for a yes vote under the guise of funding tree planting while we are in a drought, social programs that promote long-term government dependence rather than real opportunity or contribution. Prop 312 was an opportunity to address homelessness and crime, but as you leaders ignored the public's frustration, instead you chose to plant trees while ignoring issues like unsafe buses, open-air drug use in broad daylight, and rampant theft, just to name a few. Now with Prop 312 as law, property and business owners must sue over rejected claims, wasting city time, money, and resources to reclaim what's rightfully theirs. Tucson's poorest areas are the most affected. I worked third shift at Circle K on Stone and Fort Lowell, and I saw firsthand delayed police responses, sometimes up to 12 hours, repeat offenders with zero accountability, no enforcement against panhandling, all while tax revenue funds the stunting of economic growth. Yet, what does the city prioritize? Salary hikes, $700,000 electric garbage trucks, $20,000 for 26 trees for Viva projects to quote-unquote stop gun violence. The urban forestry manager for the 1 Million Trees initiative is listed on the city's website as making up to $95,000 annually. That's more than the police officers who risk their lives every single day to keep us safe, whose salary is listed at $65,000 annually. Tucson's leadership hasn't proven that they can manage funds responsibly. You have failed miserably. We the people have had enough. I'm voting no on Prop 414 and hope others do the same. Prop 414 only protects your reckless spending. Tucson doesn't need more tax hikes.
Alrighty, thank you. Catherine White. Catherine White.
Good evening. My name is Catherine White. I am a resident of Tucson. I am a former public school teacher, a current government contractor, a military spouse, and a child of 2 career police officers from my home state of Florida. I know Prop 414 has sort of been talked to death, but I am here to specifically and vehemently oppose the bloating and militarization of the Tucson police force via 414, regardless of the outcome of the special election. Though today the police officers seem to be assisting quite well with the protests that I passed on the way here, last May we saw the behavior of the Tucson police force when faced with University of Arizona students exercising their right to protest. The first dispersal request by the police officers contained a promise of violence. Tucson police used tear gas, rubber bullets, and pepper spray to violate student protesters' rights to peaceably gather. Just last month, 2 male Pima County deputies entered a women's restroom in an attempt to violate a woman's right to bodily autonomy, unreasonable search, and the security of using a public restroom in peace. In fact, they put all women in that bathroom in danger by entering as males, armed. Now, with the proposals under 414, you are calling for $530 million toward police and fire departments. While some of the funding is earmarked for addition of personnel, which I certainly do not argue with, there's also been talk of overblown, unnecessary technological luxuries, surveillance drones, and a plane. There are no funds listed for the introduction or expansion to de-escalation or crisis intervention programs or jail diversion programs. The addition of community responders like mental health professionals to work side by side with our peacekeeping forces. The entire budget seems to be laid out not to increase the safety of residents, but to increase the capacity for aggression by the police. In a time when the federal government is making sweeping changes daily, which amount to the breaking of our governmental laws and our constitutional rights, we cannot allow our peacekeeping forces here in Tucson to operate in this institutionalized manner. I am calling on you, our city council, and you, Mayor Romeo, to instruct our peacekeeping forces to protect your constituents and the Constitution, which forms the country which we have declared allegiance to at the start of this very meeting. Tucson Police Chief Chad Kazmar said of 414, policing is really expensive. Well, I'd respond that we can do better. Upholding the Constitution is a worthy expenditure. Thank you.
Thank you, Ms. White. Ben Lucero.
Good evening, Mayor, Council. I'm going to read a letter that was sent on behalf of my co-president in Peoria. It says, greetings, Mayor and Council. My name is Joshua Capilla, President of Local 3282 in Peoria. I was looking forward to attending your City Council meeting today. Due to scheduling issues, I could not attend. So I wrote a letter to show support for Local 905, the President Ben Lucero. My goal in this letter is to encourage Mayor Romero, council members, and City Manager Tim Tamir to bridge the divide between the workers and the appointed politicians in the city of Tucson. I have learned that when a city values its union, the city, the union, and most importantly, the citizens reap the reward and well-being of being an employer of choice. When a city and a union bridge bargain in good faith, that faith produces relationship, forming an unbreakable chain between the city and the union. When the city or the union falls short, respecting one another, workers and citizens lack essential services and retention. Everything we do requires good faith in pursuit of happiness. As our American Constitution promotes, I want to encourage the city to be open-minded, fair, and loving in a process that has stood for decades and improved everyone's lives with fair wages, rights, and working conditions. I have worked with Mayor Beck, the City Council, City Manager Mr. Darwin, and the Human Resources to understand everyone's needs, including the city, the union, and the residents. We have completed our bargaining in good faith, and faith produced good work for everyone. I am proud of the city of Peoria and that our union for what we accomplished in such a political climate and economic certainty for many families. I want to highlight what good faith can produce when a city and a union have one common goal, a quality of life for everyone. The city of Peoria and Ashby Local 3282 accomplishments are these agreed upon treasured wins. A 5% merit and a 2.5% COLA in year one. In 2026 and 2027, The city and the union will open up the contract negotiations and understand and promote good faith with one another. Longevity increased by 25% to honor those who have committed and dedicated their lives to the city. A 5-minute break for field workers every hour when temperatures exceed normal temperatures to keep our employees safe. Unprecedented seniority rights that have never been agreed on in 37 years. Medical insurance that helps our employees avoid hardship by offering good plans.
Come to a conclusion, Mr. Lucero. Thank you. Mitchell Salazar. Mitchell Salazar.
City Council and Mayor, my name is Mitchell Salazar. I live directly west of the university, and I am speaking for myself and members of my community. Tucson, Arizona Code of Ordinances, Section 16-31 establishes maximum permissible sound levels. In this ordinance, it states that between the hours of 7 p.m. and 7 a.m. for residential properties, the maximum permissible sound level projected beyond property lines is 62 decibels. For reference, a Google search shows a normal conversation or gentle rainfall is approximate to 62 decibels. One of the properties in our community is regularly rented out to university students and is regularly in violation of this. This has been a long-standing issue with a specific property in our community. Over the last 2 years since I have been a resident of this specific community, I personally, as well as at least one other member I have confirmed, have consistently called 911 to enforce this ordinance in relation to this property. Thankfully to the efforts of TPD and specifically the red tag unit, we have been able to address this issue in the previous scholastic year. Since the start of this new scholastic year with the return of the students renting the property, the issues have returned. Efforts to address this during this current scholastic year have unfortunately had ineffective results. One of the largest obstacles has been Tucson Public Safety Communications, who operates the 911 and 311 lines. I have been informed of a policy of theirs to not put in a call for noise ordinance violations for a TPD dispatch unless the ordinance is in correspondence of 5 or more people and verification of such. Due to this policy, it effectively makes the noise ordinance nearly meaningless itself. Along with this, even when a call is put in for TPD response, it is often slow or simply does not occur. I have been informed and understand there is a significant manning issue for the TPD and the low priority of the issue. I understand students want to have fun and enjoy their time. This does not change that this is a consistent recurring issue and affects multiple residents of my community and is in a negatively and impactful way. I imagine our community is not alone in issues of similarity. Thank you.
Thank you. Jason Warake.
Good evening, esteemed Mayor and Council. Thank you for allowing us to speak tonight. I just want to start, as I usually do at this time, by giving thanks for this process of public opinion, public input, just because my own exposure to other countries, other places in this world where people aren't allowed to speak, and speaking your opinion in public could lead to death or imprisonment. So this is a very important part of the meeting. Thank you for that. I also want to speak on Proposition 414. I'm speaking not only for myself, but for Barrio Santa Cruz Neighborhood Association, of which I'm a co-chairperson. We're not just a homeowners association. We organize in order to improve and help our own community, because about 7 or 8 years ago, we were at a real low point to where we were overwhelmed by drug use, violence, infrastructure that was failing in the streets and parks and things like that. So we organized and we reached out and we were ready to fight. We were not going to quit our cause until we got that improvement in our neighborhood. we were pleasantly surprised. We reached out to our council member, to the city of Tucson. And I could say from, we got to know people from every department, from TPD to parks, to housing, transportation, mobility, water. I'm pretty sure we could go through every department and we could tell you there was a person in this department that looked at our situation and said, yeah, we're gonna make it our job to help you. And that was really inspiring, and it helped us do better work. And it helped us believe that change was possible. The other thing that we encountered with every issue, with every problem we tried to solve, is where's the funding coming from? Where do we get the money to help with the crime, to help with the drug addiction? And somehow or another, we were able to find it. Our council member at the time, Mayor Romero, did a great job of helping us meet the people that could help us make these improvements, fix our neighborhood. We went from being a place that was uncomfortable, unsafe, homes we didn't want to go home to at the end of the day, and now we have a strong community that's united and safe and continues to make improvements. Now to move on to the subject of the proposition, we've discussed this in our neighborhood. And the first thing that came up is times are really hard right now. When I get my check, when it's direct deposited in my bank, I don't see it. It goes straight out to bills. Our groceries, we get 2 bags of groceries that cost $100. So can we afford to make this payment? And what we came up to was we cannot afford not to. All right, we're still in the middle of a drug epidemic. We're still in the middle of major gun violence. And everybody knows someone who's either addicted, who's either been moved out of their house due to higher rent, or has lost their lives to violence in the streets. You can't turn on the news each day without hearing about someone lost to gun violence. We can all read online what this proposition can do for the city. It's not just a new plane for the TPD, but it addresses each and every of these problems and will give us a safer place to live. I'm sorry for going over my time. I just want to say, with funding being cut, if we do not bring in more funding to the city, we're not going to be able to keep up. We're going to be knocked back, and these epidemics will overcome us.
Thank you so much, Mr. Huaraque. Really appreciate it. Finn Anderson. Finn Anderson.
Hi, everybody. I first came to Tucson in 1948. That's when you could see the Milky Way at Reed Park. I was 6 years old. To help you figure out my age, because I know it's going through your mind, I'm 83 years old. I was a school teacher, a high school principal, and a school superintendent. I also chaired a committee comprised of the FBI, IRS, and ATF to go after organized crime and arson for profit schemes. But that's not why I'm here. My wife, Mitchell, and I organized the first protest in the nation at the Tesla dealership against Trump and Musk. The one we had last Saturday was national news at CNN, New York Times, and MSNBC. We're very happy about how that all turned out. We had 1,320 people there at that time. So as we were the first to organize these, we would like you to be the first in the nation to pass the following resolution. It's titled, No Executive Overreach, Supporting the United States Constitution and Defending Our Democracy. It reads as follows. Whereas the Mayor and Council of Tucson, Arizona, believes nothing is more sacred to our democracy than the United States Constitution. Whereas the Mayor and Council feels an essential part of our Constitution are the 3 first articles, establishing the 3 separate but equal branches of the United States government. Whereas the Mayor and Council has witnessed the consolidation of power in the executive branch by the current president through the following actions: the revocation of the birthright citizenship, freezing of federal spending approved by Congress, shuttering of federal agencies, generally demonstrating a pattern of absurding the duties of the legislative branch, violating due process and civil service protections for federal employees, threatening to deport people based on political views, disobeying judicial mandates, polarizing law enforcement and the military, chilling debate by threatening legislators not loyal to him, generally expressing contempt by the separation of powers, freedom and speech, and equal justice under the law. Now, therefore, be it resolved that the mayor and council believe that those elected to office have a duty to protect the Constitution and must act in urgency. And now, therefore, be it resolved that the mayor and council strongly urge the United States congressional delegation of the state of Arizona to take the lead
Anderson,
in
we
pressing
need
their
to come to a
colleagues,
conclusion.
my last sentence, to stand up and reclaim the constitutional duty as an equal partner of running the United States government. We have a copy for you to consider.
Thank
so
you,
if you
Mr.
consider it, I
Anderson.
appreciate it.
We do have a member of the clerk's office that still needs to get your phone number and email address, just so that someone can contact you for further information. And our last speaker is Dale Drain.
Good evening, and thank you for the opportunity to be here. It's the second time, and certainly not the last. I want to take the time to thank you or whoever was involved in allowing code enforcement complaints to take pictures. Because when I first started, that wasn't allowed, and why? Common sense, if somebody's sending problem pictures in, you can look at them and act on them. So that kind of led me to believe somebody was concealing something. I want to thank you for relocating the Code Enforcement Agency. I understand that's now under planning and development. Baby steps, unfortunately. I'm curious, and I hope I can get an answer. Are Planning and Developmental Services, PDSD, and Code Enforcement, CE, and the floodplain construction limitations, are those relevant to the city? Somebody.
Sir, if you could just continue with your comments during call of the audience.
Okay.
There can't be a back and forth discussion.
Okay. Thank you for helping with that. I had a meeting with the Planning and Development Department and Code Enforcement Departments. At that time, I had a book like this. I've spent a lot of money putting this stuff together. There's a lot of corruption going on. You want to save money? You've got millionaires in this town because they're screwing the city out of money on building permits. That's the reality. Look up the goat of Tucson, Eddie Waters. It's a YouTube video. It's only 43 minutes. Has anybody looked at it? I brought it up before. I doubt it, but that's malfeasance. Because you see, he tells how he spent $1,100,000 buying a property. He and his partners invested $1 million and didn't take out building permits. I turned it in 6 months ago. You still let them be occupied. Are you kidding me? Not only that, that's 1030 East Lee Street. You've got students that are in those buildings that have never been inspected. These cover properties before 326 East Prince Road. I went to Planning and Development with pictures of 326 East Prince Road. I showed them it's being done right now, and you're not stopping it. I'll be back another time.
Thank you, Mr. Drain. Really appreciate you all. Thank you, everyone, for attending Call to the Audience. That was our last speaker, and so we're moving on to item 7.
Consent agenda, items A and B.
Reports from the city manager on the consent agenda are received into and made part of the record. Ms. Clerk, you are requested to read the consent agenda.
Item A is approval of minutes. Item B is a financial participation agreement with Tucson Clean and Beautiful, TCB, for fiscal year FY 24-25.
May I have a motion to approve the consent agenda, please?
So moved.
Second?
There's a motion and a second. Any further discussion on this? Seeing none, we do need to go to roll call.
Vice Mayor Santa Cruz,
Aye.
Mr. Dahl,
Aye.
Mr. Fimbres,
Aye.
Mr. Cunningham. Mrs. Lee.
Aye.
Mixulic. Mayor Romero.
Aye. The items on the consent agenda are approved by a vote of 7-0. Item 8.
Public hearing, bingo license application, Arnette Creek LLC, 7215 East 22nd Street, Suite 101.
City Manager's Communication Number 67 dated March 4th is received into and made part of the record. This time and place is legally advertised for a public hearing to take formal action on a bingo license application for Arnette Creek LLC. This public hearing is scheduled to last for no more than 1 hour. Speakers are limited to 5-minute presentations. Do we have any speakers, please?
No, ma'am.
We have no speakers at the time. Is anyone here in the audience wishing to be heard on this item? Seeing none, is there a motion?
I move to close the public hearing, Your Honor.
Okay.
Second?
There's
Second.
a
Second.
motion and a second to close the public hearing. Any discussion on this? All those in favor signify by saying aye.
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 Any against? Motion carries. The public hearing is closed. Ms. Clerk, you are requested to read Resolution 23897 by number and title only.
Resolution number 23897 relating to city clerk, approval of bingo license application for Arnette Creek LLC.
What is the council's pleasure?
Your Honor, I move we pass and adopt permit number 23897.
Second.
There's a motion and a second. Any further discussion? Hearing none, let's go to roll call.
Mr. Cunningham.
Aye.
Mr. Fimbres,
Aye.
Vice Mayor Santa Cruz.
Aye.
Mr. Dahl,
Aye.
Mrs. Lee.
Aye.
Mixulic. Mayor Romero.
Aye. Resolution 23897 passes by a vote of 7-0. Item 9.
Adjournment.
Council will stand adjourned. The next regularly scheduled meeting will be on Tuesday, March 18th, 2025, at or after 5:30 p.m. Thank you, everyone. Thank you for coming, and have a wonderful rest of your week.